Kaplan NCLEX Readiness Exam. Flashcard 1. The nurse cares for a client with a cuff tracheostomy tube. Before performing oral care, the nurse notes that the client's tracheostomy cuff is inflated. Which of the following is the most appropriate action for the nurse to take? 1. Leave the cuff inflated and suction through the tracheostomy. 2. Deflate the cuff and suction through the tracheostomy tube. 3. Inflate the cuff pressure to 40 mmHg before suctioning. 4. Adjust the wall suction pressure to 160 to 180 mmHg before suctioning. Think of the answer before the reveal. The answer is 1. Correct implementation. Outcome desired. Cuff inflation decreases the risk of aspiration. Cuff position and pressure should be assessed frequently. Swallowing and breathing will cause tracheostomy tube movement to implementation. Outcome not desired. Accumulated oral secretions above the cuff will drain into the bronchi. Increased risk of infection. 3. Implementation. Outcome not desired. Cuff pressure should be less than 20 mmHg 25 cmH2O. Risk of trauma to trachea with higher pressures. 4. Implementation. Outcome not desired. Increases the risk of trauma to lower airways. Flashcard 2. A young adult brings a friend to the emergency department and states that the friend has been using heroin. Which action by the nurse is the most appropriate? 1. Assess pupil size and reactivity. 2. Assess oxygen saturation levels. 3. Palpate dorsalis pedis pulses. 4. Ask the client if he knows today's date. Think of the answer before the reveal. The answer is 1. Assessment. Outcome not priority, but may be appropriate. Pinpoint pupils are a sign of heroin overdose. 2. Correct assessment. Outcome priority. Shallow respirations seen. Impaired alveolar gas exchange and possible respiratory arrest. 3. Assessment. Outcome not priority. Most important to assess airway and breathing. 4. Assessment. Outcome not priority, but may be appropriate. Drowsiness and euphoria may be seen. Not priority. Flashcard 3. The client tells the clinic nurse that the client is thinking about using nicotine polyacrylex Nicorette. Which question is most important for the nurse to ask? 1. Have you tried other methods to stop smoking? 2. How long have you been smoking? 3. Have you ever had chest pain? 4. Do you have a partial dental bridge? Think of the answer before the reveal. The answer is 1. Assessment. Outcome not priority, but may be appropriate. Can be asked as part of assessment to assessment. Outcome not priority, but may be appropriate. Should be assessed for further teaching. 3. Correct assessment. Outcome priority. Action of nicotine is vasoconstriction. Increases heart rate and myocardial oxygen consumption. Increased risk of angina and myocardial infarction. 4. Assessment. Outcome may be appropriate, but not priority. Gum is placed between cheek and gums. May stain dental work. Flashcard 4. The nurse cares for the client with a client-controlled analgesia PCA pump. The nurse determines that the client has pressed the button 11 times and received 6 doses of morphine during the last hour. Which is the most appropriate action for the nurse to take? 1. Assess the patency of the PCA Roman 4 tubing. 2. Determine the client's understanding of the PCA pump function. 3. Obtain an order to begin a PCA infusion of fentanyl. 4. Ask the client to describe the pain. Think of the answer before the reveal. The answer is 1. Assessment, outcome not priority, but may be appropriate. If tubing is obstructed, alarm is activated to assessment. Outcome may be appropriate, but not priority. More important to determine pain level, description of the pain, region and radiation of the pain, and relieving factors. 3. Implementation. Outcome not desired. More important to assess severity of pain and pain relief. First. 4. Correct assessment. Outcome priority. Must validate that client is in pain before implementation. Flashcard 5. A pregnant woman receives an epidural anesthetic. After administration of the epidural anesthetic, the client's blood pressure changes from 120/84 to 94/50. Which action by the nurse is most appropriate? 1. Place the client flat on her back. 2. Elevate the head of the bed 30 degrees. 3. Place the client on her left side with her legs flexed. 4. Place the client supine with the foot of the bed elevated. Think of the answer before the reveal. The answer is 1. Implementation, outcome not desired. No increase in venous return. 2. Implementation, outcome not desired. Will decrease venous return. 3. Correct implementation, outcome desired. Will increase venous return and cardiac output. Feel pressure on inferior vena cava reduced. 4. Implementation, outcome not desired. Elevation of legs will increase venous return, but feel pressure on vena cava will prevent blood return to heart. Flashcard 6. The nurse prepares to administer the initial dose of oral enalapril 20 mg in the morning. Which medication should the nurse question giving to the client? 1. 20 mg oral escitalopram Celexa in the morning. 2. 40 mg oral furosemide Lasix in the morning. 3. 300 mg of oral gabapentin Neurontin twice daily. 4. 10 mg Zolpidem Ambien at bedtime. Think of the answer before the reveal. The answer is 1. Implementation, outcome not a problem. No interaction with ACE inhibitors is an SRI antidepressant. 2. Correct implementation, outcome potential problem. May promote significant diuresis. First dose of ACE inhibitors increases risk of first dose phenomenon due to vasodilation. Combination of vasodilation and diuresis increases risk of orthostatic hypotension. 3. Implementation, outcome not a problem. No interaction. Gabapentin classified as anti-seizure medication. Off-label use for neuropathic pain. 4. Implementation, outcome not a problem. Is a hypnotic. No interaction with ACE inhibitors. Flashcard 7. The nurse on the maternity unit must accept a transfer client from a medical/surgical unit. The nurse considers which transfer client appropriate. 1. A 38-year-old client with a diagnosis of systemic lupus erythematosus. 2. A 45-year-old client receiving daily external radiation therapy treatments for breast cancer. 3. A 58-year-old client receiving antibiotic treatment for cellulitis of the left leg. 4. A 74-year-old client who has received intravenous antibiotics for 7 days. Think of the answer before the reveal. The answer is 1. Correct implementation, outcome desired. Autoimmune disease, not infectious. 2. Implementation, Outcome not desired. Possible skin damage and suppression of bone marrow with decreased white blood cell levels. Increased risk for infection. 3. Implementation. Outcome not desired. Generalized skin infection of deeper connective tissue, usually caused by Streptococcus or Staphylococcus. Increased risk for infection. 4. Implementation. Outcome not desired. Elderly clients receiving long-term antibiotic therapy are at risk for Clostridium difficile infection, highly contagious. Increased risk for infection. Flashcard 8. The nurse in the outpatient surgery unit prepares a 4-year-old child for surgery. It is most important for the nurse to make which of these statements? 1. Your parents are going to leave a half hour before the surgery. 2. You're going to talk with some other children who had this surgery. 3. If you have this surgery, your parents will buy you a new toy. 4. Take this doll and show me where the operation will be done. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired. Parents are encouraged to remain with child. 2. Implementation. Outcome not desired. Appropriate only for school-aged and adolescent children. 3. Implementation. Outcome not desired. Not appropriate for correct implementation. Outcome desired. Encourage expression of feelings, for example, anger, fear, mutilation. Allow child to play with models of equipment. Flashcard 9. The nurse cares for a client diagnosed with Alzheimer's disease. The client is confused and incontinent of urine. What is the most important action for the nurse to take? 1. Insert an indwelling urinary drainage catheter. 2. Perform intermittent catheterization every 4 hours. 3. Offer the bedpan to the client every 2 hours. 4. Assist the client to a bedside commode every 2 hours. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired. Increases risk of infection. Catheter-related infections are most common hospital-acquired infection. 2. Implementation. Outcome not desired. Increases chance of infection. 3. Implementation. Outcome appropriate, but not priority. Does not keep client independent and active for correct implementation. Outcome desired. Keeps client active and independent. Flashcard 10. The nurse cares for a client with a history of type 1 diabetes mellitus who has just returned to the surgical acute care unit after a right below knee amputation. The client's capillary blood glucose is 480 mg/dl. The postoperative orders indicate 6 units of regular insulin subcutaneously should be administered. Which of the following is the first action the nurse should take? 1. Check the client records to see if insulin was given prior to surgery. 2. Administer the 6 units of regular insulin subcutaneously. 3. Administer the insulin when oral fluids are tolerated. 4. Contact the healthcare provider. Think of the answer before the reveal. The answer is 1. Assessment. Outcome desired, but not priority. Client needs insulin coverage now. 2. Correct implementation. Outcome desired. Sliding scale receives predetermined amount of insulin according to glucose level. Surgery and infection increase insulin needs. 3. Implementation. Outcome not desired. Needs insulin regardless of oral intake due to elevated blood glucose. 4. Implementation. Outcome not desired. No reason to contact healthcare provider. Order is valid and appropriate for situation. Flashcard 11. During the admission interview, the client reports a red, itchy raised rash on the chest and lip swelling after use of aspirin and penicillin. The admission orders include bed rest, soft diet as tolerated, naproxen naproxen, and cefaclor. Which is the best description of expected breath sounds heard during auscultation? 1. Administer the seclor as ordered. Do not administer the naproxen. 2. Administer the naproxen as ordered. Do not administer the seclor. 3. Administer both the seclor and naproxen as ordered. Document the client's response. 4. Do not administer the seclor or naproxen. Notify the healthcare provider. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired. Cephalosporins have cross allergies with penicillins. 2. Implementation. Outcome not desired. NSAID should be used cautiously with aspirin allergies. 3. Implementation. Outcome not desired. Both medications should be withheld due to allergies. 4. Correct implementation. Outcome desired. Both medications should be withheld. Risk of hypersensitivity reaction. Flashcard 12. The nurse teaches a client about how to care for an ileostomy. Which comment, if made by the client to the nurse, indicates further teaching is needed? 1. The skin around the stoma should be cleaned with warm water and thoroughly dried. 2. The appliance should fit snugly around the ileostomy opening. 3. I should take polyethylene glycol Miralax with a large glass of water. 4. I will continue to take a daily multivitamin. Think of the answer before the reveal. The answer is 1. Implementation. Outcome desired. Standard of care for ileostomy. 2. Implementation. Outcome desired. Ileostomy drainage is liquid and very alkaline. Great risk of skin irritation. 3. Correct implementation. Outcome not desired. Osmotic laxative and is contraindicated. Avoid enteric-coated or capsule medication, which may not be absorbed through GI tract. 4. Implementation. Outcome desired. Inform healthcare provider and pharmacist about ileostomy. Flashcard 13. The nurse cares for a client diagnosed with chronic bronchitis and peripheral vascular disease. The nurse expects to assess which of these breath sounds. 1. Continuous, high-pitched musical sounds heard on expiration. 2. Soft, high-pitched interrupted sounds heard on inspiration. 3. Deep, low-pitched rumbling sounds are heard mainly on expiration. 4. Harsh, grating sounds heard best during inspiration. Think of the answer before the reveal. The answer is 1. Assessment. Outcome not expected. Sibilant wheezes, heard with asthma caused by narrow bronchioles. 2. Assessment. Outcome not expected. Crackles, heard with pneumonia, and CHF, caused by fluid in the alveoli. 3. Correct assessment. Outcome expected. Sonorous wheezes or rhonchi, caused by mucus in the airways. Excessive mucus production is primary symptom for assessment. Outcome not expected. Pericardial friction rub, caused by inflamed pleura or pericarditis. Flashcard 14. The nurse prepares to administer gentamicin garamicin to the 65-year-old client. Which is the most important action for the nurse to take prior to administration of the medication? 1. Request a daily hemoglobin and hematocrit test. 2. Monitor the serum BUN and creatinine. Free. Request a highly sensitive C-reactive protein hsCRP test. 4. Monitor the erythrocyte sedimentation rate ESR. Think of the answer before the reveal. The answer is 1. Assessment. Outcome not priority may cause anemia, but not usually seen. 2. Correct assessment. Outcome priority, nephrotoxic, will see proteinuria, oliguria, hematuria, thirst, increased BUN, decreased creatine clearance. 3. Assessment. Outcome not priority will be increased in inflammation and rheumatoid arthritis. 4. Assessment. Outcome not priority will be increased with any inflammatory process. Flashcard 15. The nurse cares for the client in the labor unit. During the transitional phase of labor, the umbilical cord becomes prolapsed. It is most important for the nurse to take which action? 1. Place the client on her back with thighs flexed on her abdomen. 2. Place the client on her left side with legs flexed. 3. Place the client supine with the head of the bed elevated 30 degrees. 4. Place the client supine with the foot of the bed elevated. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired. Lithotomy position will not decrease pressure on umbilical cord. 2. Implementation. Outcome not desired. Position used to remove weight of fetus from vena cava to prevent maternal hypotension will not help with prolapsed cord. 3. Implementation. Outcome not desired would aggravate prolapsed cord pressure. 4. Correct implementation. Outcome desired. Trendelenburg or knee chest position desired to decrease pressure on umbilical cord. Flashcard 16. The nurse cares for the client diagnosed with lung cancer. The family states that the client has become confused and that urinary output has decreased during the previous 24 hours. Which finding most concerns the nurse? 1. 2+ pitting pertibial edema. 2. Sodium 128 mg/L. 3. Weight gain of 2 kg in 24 hours. 4. Urine-specific gravity 1.8. Think of the answer before the reveal. The answer is 1. Assessment. Outcome desired, but not priority. Edema not seen with SIAD even though water is retained. Needs to be monitored. to correct assessment. Outcome desired and priority. Normal sodium range is 135-145 mg/L. Dilutional hyponatremia due to SIAD. Client is neurologically depressed with increased risk of seizures. 3. Assessment. Outcome desired, but not priority. Indicates fluid retention, not as important as hyponatremia. Important to watch trends in weight. 4. Assessment. Outcome not desired. 1.008 indicates that urine is very dilute. With SIAD, urine will have high concentration and specific gravity due to excess ADH secretion. Flashcard 17. The home care nurse cares for a client who is diagnosed with hypertension and mild depression. The client's daughter states that her mother has been falling frequently. Which response by the nurse is best? 1. Let's get your mother a walker. 2. Do you think it's time to put your mother in a nursing home? 3. When does your mother fall? 4. Does your mother seem to be more confused lately? Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired. Need to assess first to assessment. Outcome not priority. Yes/no question. Doesn't help determine the problem. 3 correct assessment. Outcome priority. Nurse needs to determine what the problem is before implementing. Recent history of falling is most important contributor to increased risk of falls for assessment. Outcome not priority. Yes/no question is non-therapeutic. Need to assess may be a contributing factor. Flashcard 18. A femoral angiogram is scheduled for a client. It is most important for the nurse to take which action prior to the angiogram? 1. Clean and shave the catheter insertion site area. 2. Locate and note the presence of peripheral pulses. 3. Encourage the client to increase oral fluid intake. 4. Teach coughing and deep breathing exercises. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired. Cleansing may be done according to facility policy. Shaving may not be recommended due to possible abrasions and increased risk of infection. 2. Correct assessment. Outcome desired and priority. Pulse location may be marked according to facility policy. Important to get baseline assessment of color, motion, temperature, and sensitivity of extremities as well as strength and equality of pulses. 3. Implementation. Outcome not desired. NPO 8 hours prior to test. Dye may cause possible nausea. Fluid intake should be increased after procedure to clear dye and reduce risk of renal toxicity. 4. Implementation. Outcome desired, but not highest priority. Not at greatly increased risk for atelectoses. Flashcard 19. A child sustains a crushing chest injury in a car accident. In the emergency room, an endotracheal tube is inserted. Several hours later, the nurse enters the client's room and finds the child in respiratory distress. It is most important for the nurse to take which action prior to the angiogram? 1. Observe the color of the client's fingernail beds. 2. Assess the client's blood pressure in both arms. 3. Listen to the client's breath sounds. 4. Assess for intercostal retractions. Think of the answer before the reveal. The answer is 1. Assessment. Outcome desired, but not priority. Cyanosis is a late sign of respiratory distress. Central cyanosis will occur later than peripheral cyanosis. 2. Assessment. Outcome not desired. Priority is to assess respiratory status. Blood pressure may change due to decreased arterial oxygen levels. Priority is to correct underlying problem. 3. Correct assessment. Outcome priority will give early and clearest indication of respiratory status. Will hear changes with narrowed airways, fluid in alveoli, or pneumothorax. 4. Assessment. Outcome desired, but not priority. Late indication of respiratory distress. Intercostal muscles are accessory muscles. Flashcard 20. The nurse cares for an elderly man diagnosed with Alzheimer's disease. It is most important for the nurse to take which action? 1. Leave the television on all day in the client's room. 2. Frequently inform the client of the room and bathroom location. 3. Provide the client with newspapers and magazines. 4. Assign a staff member to check on the client every 15 minutes. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired. Does not address orientation needs. Risk of overstimulation. Television should be on intermittently to correct implementation. Outcome desired. provides for safety needs and frequent orientation. 3. Implementation. Outcome not priority. Does not address safety needs or orientation. 4. Implementation. Outcome desired not priority. Addresses safety, but not orientation or stimulation needs. Flashcard 21. The nurse cares for a client diagnosed with Crohn's disease. The nurse instructs the client about diet. Which menu selection indicates to the nurse that teaching is effective? 1. Cheeseburger on a whole wheat bun, French fries, and an apple. 2. Tomato soup, saltines, and a slice of unfrosted angel food cake. 3. Baked cod, biscuit without butter, fruit roll-up. 4. Macaroni and cheese, coleslaw. 2. Macaroon cookies. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired. High fat, high protein, high residue. High residue contraindicated. 2. Implementation. Outcome not desired. Low fat, low protein, low residue. 3. Correct implementation. Outcome desired. Low fat, high protein, low residue, non-irritating, high in calories, minerals. 4. Implementation. Outcome not desired. High fat, low protein, high residue, may cause diarrhea. Flashcard 22. The nursing team consists of 1 RN, 1 LPN/LVN, and 2 nursing assistive personnel NAPs. Which assignment is most appropriate for the LPN/LVN? 1. A 38-year-old client diagnosed with Guillain-Barré syndrome receiving plasmapheresis therapy. 2. A 72-year-old client admitted yesterday with a 10-day history of oral antibiotic therapy and a 24-hour history of watery diarrhea. 3. A 78-year-old client diagnosed with a thrombotic cerebrovascular accident 5 days ago. 4. A 86-year-old client just admitted with malaise, a productive cough, and WBC 17,000 mm3. Think of the answer before the reveal. The answer is 1. Outcome not desired. Requires frequent assessment of neuromuscular function and monitoring response to therapy. 2. Outcome not desired. Elderly clients are at risk for Clostridium difficile infection due to antibiotic therapy. Client would need frequent assessment and evaluation. 3. Correct outcome desired. LPN/LVN can care for stable clients with expected outcomes. Nothing in question indicates instability. As cerebral edema resolves, the condition will improve. 4. Outcome not desired. Client requires frequent assessment and evaluation. WBC indicates possible infection. Flashcard 23. The nurse cares for a client during a 24-hour urine specimen collection. Several hours later, the client tells the nurse that she has started to menstruate. Which action by the nurse is most appropriate? 1. Inform the healthcare provider that the client is menstruating. 2. Send the urine collected prior to the onset of the client's menstruation to the lab. 3. Insert an indwelling bladder catheter during the remainder of the collection period. 4. Request a separate urine collection container from the laboratory to be used during the remainder of the urine collection period. Think of the answer before the reveal. The answer is 1. Correct implementation. Outcome desired. Menstruation may last several days to a week. Protein and red cells may alter the results of the urinalysis. 2. Implementation. Outcome not desired. All urine must be collected for accuracy. 3. Implementation. Outcome not desired. Invasive procedure should be avoided if possible for implementation. Outcome not desired. Would change the results of the 24-hour urine sample. All urine must be collected for accuracy. Flashcard 24. The nurse cares for the client in the recovery room after a knee surgery procedure. The client has an oral airway in place. Which is the best indicator that the oral airway can be removed? 1. The client has a forceful cough during repositioning. 2. The client responds to a normal spoken voice. 3. The client tries to chew on the oral airway. 4. The client is able to swallow. Think of the answer before the reveal. The answer is 1. Assessment, outcome not priority, may cough due to irritation of the airway. Does not reflect client responsiveness to correct assessment. Outcome priority, client is alert and able to maintain his own airway. 3. Assessment, outcome not priority, client needs to be responsive before airway is removed. Maybe a reflexive action. 4. Assessment, outcome not priority, client will be able to swallow before he's responsive. Flashcard 25. The nurse cares for clients in the antepartum clinic. Which client should the nurse see first? 1. An 18-year-old multigravida client at 28 weeks gestation with a positive indirect Coombs test. 2. A 24-year-old multigravida client at 32 weeks gestation with moderate facial edema. 3. A 30-year-old client at 26 weeks gestation with bilateral yellow breast exudate. 4. A 43-year-old primigravida client at 18 weeks of gestation reporting an absence of fetal movement. Think of the answer before the reveal. The answer is 1. Outcome not priority, indicates that Rh antibodies present, needs further investigation to correct. Outcome priority, indicates preeclampsia, requires immediate evaluation, is at risk for complications. 3. Outcome not priority, colostrum may leak from breast during pregnancy. Normal finding. 4. Outcome not priority, normal finding, quickening doesn't occur before 18 weeks in primigravidas, 20 weeks in multigravidas. Flashcard 26. The nurse instructs a client about include digoxin, lanaxin, furosemide, lasix, spironolactone, aldactone, and a low-sodium diet. Which statement by the client indicates the need for further instruction? 1. I should weigh myself every morning and call the healthcare provider if I gain more than a couple of pounds in a few days. 2. I should call the healthcare provider immediately if I start to feel nauseated or have difficulty breathing with normal activities. 3. I plan to use salt substitutes now that I have to limit my sodium intake. 4. I should read food and non-prescription medication labels to check the ingredients. Think of the answer before the reveal. The answer is 1. Implementation, outcome desired, would indicate fluid retention. 2. Implementation, outcome desired, symptoms of digitalis toxicity. CHF 3. Correct. Implementation, outcome not desired, salt substitutes contain potassium. Spironolactone is a potassium-sparing diuretic. 4. Implementation, outcome desired, some medications may contain sodium and potassium. Flashcard 27. The nurse cares for a client scheduled for a femoral popliteal bypass procedure. When the nurse approaches the client with the informed consent form, the client says, I don't need to talk to anybody about this procedure. I already know everything I need to know about it. Which response by the nurse is best? 1. After I explain the operation to you, both of us will sign the form for legal purposes and it will be placed in your chart. 2. Tell me what the healthcare provider told you about the risks and benefits of this operation. 3. Can I answer any questions that you have about the procedure? 4. You should read all these materials to be sure that you understand everything about this procedure. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired. Nurse should not explain the procedure. The healthcare provider doing the procedure should explain the risks and benefits to correct assessment. Outcome desired. Nurse should determine if client understands risks and benefits of the procedure before the client and nurse sign the informed consent form. 3. Implementation. Outcome not desired. Yes/no question on therapeutic response. 4. Implementation. Outcome desired, but not priority. Reading materials do not ensure that client understands risks and benefits of the procedure. Flashcard 28. A man scheduled for a vasectomy tells the nurse that he and his wife are involved in a monogamous relationship. Which statement by the nurse is best? 1. You will need to wear a condom when having sexual intercourse for 6 weeks following the vasectomy. 2. No other form of birth control is necessary for you or your wife at this time. 3. You do not need to wear a condom when having sexual intercourse for the next few weeks, but your wife should use spermicidal jelly. 4. Always wear a condom when having sexual intercourse because not all vasectomies are successful. Think of the answer before the reveal. The answer is 1. Correct. Implementation. Outcome desired. Sperm count decreased after the vasectomy. Some sperm may remain in the vas deferens. 2. Implementation. Outcome not desired. Sperm stored in vas deferens may be ejaculated for several weeks after the vasectomy. 3. Implementation. Outcome not desired. Not effective enough. 4. Implementation. Outcome not desired. Considered successful after 2 negative sperm counts. Flashcard 29. The nurse prepares to assign a client requiring a capillary blood glucose test to a newly hired nursing assistive personnel. Which action should the nurse take first? 1. Show me how you check a capillary glucose level. 2. How many of these glucose checks have you done in the past? 3. Would you like for me to go with you when you do the glucose test? 4. Was this procedure covered during your nursing assistive personnel class? Think of the answer before the reveal. The answer is 1. Correct assessment. Outcome priority. Must evaluate competency of the UAP. Nurse is accountable for UAP's actions during delegation process to assessment. Outcome not priority. Number of procedures done is not as important as demonstrated competency. 3. Assessment. Outcome not priority. Nurse should be able to delegate procedure if UAP is competent. 4. Assessment. Outcome not priority. Obtaining a capillary glucose sample is within UAP scope of practice. Flashcard 30. A 12-year-old diagnosed boy with a fractured right femur is placed in balanced suspension traction with a Thomas splint and Pearson attachment. The nurse is most concerned by which client statement? 1. I will experience more muscle spasms and pain while my leg is in traction. 2. I can lift my body up while I grab the overhead trapeze and bend my left leg. 3. The healthcare provider told me it is okay to move the head of my bed up and down by myself. 4. I need to put the phone where I can reach for it without moving onto my side. Think of the answer before the reveal. The answer is 1. Correct implementation. Outcome not desired. Muscle spasm should decrease with traction. If muscle spasm pain increases, the amount of traction weight should be assessed to implementation. Outcome desired. Vertical movement is allowed as long as line of pull is maintained. 3. Implementation. Outcome desired. Balanced suspension traction not affected by movement of bed, not affected by client movement, unless line of pull affected. 4. Implementation. Outcome desired. Can move up and down only. Moving side to side changes line of pull of traction. Flashcard 31. The nurse prioritizes the needs of a client who has been raped. Which nursing action is most important? 1. Observe the client for withdrawn, tearful behavior. 2. Determine if the client sustained any injuries. 3. Obtain information about events which preceded the rape. 4. Accurately document the client's comments about the rape. Think of the answer before the reveal. The answer is 1. Assessment. Outcome not priority. Psychosocial assessment. Eliminate. Address physical needs first. 2. Correct assessment. Outcome priority. Physical needs are highest priority. 3. Assessment. Outcome desired, but not highest priority. Address physical needs first. 4. Implementation. Outcome not highest priority. Legal documentation is not the highest priority. Flashcard 32. The nurse reviews medications with a 35-year-old female. The client takes 200 mg carbamazepine Tegretol orally twice daily. The client asks the nurse about future pregnancies. Which statement by the nurse is most appropriate? 1. If you take 5 mg folic acid daily while trying to conceive, you should be able to get pregnant. 2. It is recommended that you take carbamazepine suspension instead of the tablets when trying to get pregnant. 3. You should contact your healthcare provider and discuss your concerns about pregnancy. 4. If you avoid drinking grapefruit juice, there should be no problem with conception. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired. Carbamazepine and valproic acid increase risk of birth defects. Daily folic acid decreases risk of neural tube defects if taken during pregnancy. Folic acid will not increase fertility. 2. Implementation. Outcome not desired. Possible birth defects due to action of the medication. Route of administration does not matter. 3. Correct implementation. Outcome desired. Carbamazepine may be teratogenic. The healthcare provider should discuss risks and benefits with client. 4. Implementation. Outcome not desired. Grapefruit juice can increase serum levels of carbamazepine as much as 40%. Flashcard 33. The nurse cares for the client 3 days after a stroke. It is most important for the nurse to take which action? 1. Instruct the client to push with the feet while moving client up in bed. 2. Offer the client soft foods on request. 3. Auscultate the client's lungs every 4 hours. 4. Observe the client's legs for warm, reddened, and tender areas every 4 hours. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired. If client holds breath, may increase intracranial pressure. 2. Implementation. Outcome not desired. Need to assess risk for aspiration first before any oral fluids or foods given. 3. Correct assessment, outcome desired, and priority. Decreased oxygen levels will increase intracranial pressure. Client at high risk for aspiration. 4. Assessment, outcome desired, but not priority. At risk for thrombophlebitis due to immobility. Flashcard 34. The nurse cares for the client diagnosed with schizophrenia. Which question is most important for the nurse to ask the client's spouse? 1. Have you noticed loud talking and excessive restlessness lately? 2. Has your spouse seemed withdrawn and less responsive to you during the last few weeks? 3. How would you describe your spouse's daily consumption of alcohol? 4. Does your spouse appear to have lost weight recently? Think of the answer before the reveal. The answer is 1. Assessment, outcome not priority. Manic client, bipolar disorder. Symptoms include inappropriate dress, excessive talking, lack of inhibition, inability to stop moving, disorientation. 2. Correct assessment, outcome priority. May withdraw from previous relationships or regress to previous behavior levels. 3. Assessment, outcome not priority. No data to support relationship. 4. Assessment, outcome not priority. Secondary to withdrawn behavior, common with other psychiatric problems. Flashcard 35. The nurse cares for the client immediately after an ileostomy procedure. Which is the best initial action for the nurse to take during client teaching? 1. Schedule the teaching demonstrations during family visits. 2. Encourage the client to discuss any concerns and to ask questions. 3. Show a video demonstrating ileostomy care. 4. Perform care for the ileostomy until the client is able to do it herself. Think of the answer before the reveal. The answer is 1. Implementation, outcome not desired. Must assess client's readiness to learn first. 2. Correct assessment, outcome desired. Ventilate feelings and assess readiness to learn. 3. Implementation, outcome not desired. Needs to be ready to learn. 4. Implementation, outcome not desired. Won't assist in adjustment. Flashcard 36. The nurse cares for an 84-year-old man who appears disheveled, restless, and confused. The nurse prepares to administer medication and observes that the client's armband is missing. Which is the most appropriate action for the nurse to take? 1. Ask the client's roommate to identify the client. 2. Ask the client to state his name. 3. Ask another nurse to identify the client. 4. Look in the chart at the picture of the client. Think of the answer before the reveal. The answer is 1. Implementation, outcome not desired. Passing the buck, mental status of roommate unknown. 2. Implementation, outcome not desired. Client confused. 3. Implementation, outcome not desired. Passing the buck, must check identification. 4. Correct implementation, outcome desired. Only way to positively identify client. Flashcard 37. The nurse performs an assessment of a newborn boy. The nurse is most concerned if which of the by which observation. 1. The respiratory rate is 40 per minute with short periods of apnea. 2. The heart rate is 140 beats per minute with variation during sleeping and waking states. 3. A sudden loud noise causes abduction of the infant's arms and flexion of his elbows. 4. Stroking the outer sole of the infant's foot upward causes his toes to curl downward. Think of the answer before the reveal. The answer is 1. Assessment. Outcome not a problem. 30-60 breaths/min with periods of apnea. Normal to assessment. Outcome not a problem. 120-160/minute. Varies while asleep and awake. 3. Assessment. Outcome not a problem. Startle reflex. Normal until 4 months for correct assessment. Outcome not expected and is a problem. Babinski reflex. In newborn, should see dorsiflexion of big toe. Flashcard 38. The nurse cares for the client diagnosed with type 2 diabetes. The client is scheduled for a renal computed tomography scan with contrast media at 10 a.m. The nurse is most concerned if the client makes which statement? 1. My blood sugar was 124 mg/dl this morning. 2. I drank a glass of water at midnight. 3. Sometimes I get dizzy when I first get out of bed. 4. I took my metformin glucophage ER at 6 a.m. this morning. Think of the answer before the reveal. The answer is 1. Assessment. Outcome not desired, but not priority. Further assessment needed. 2. Implementation. Outcome not a problem. MPO for 8 hours prior to scan. 3. Assessment. Outcome not desired, but not priority. Possible orthostatic hypotension. Further assessment needed. 4. Correct implementation. Outcome not desired and priority. Metformin should be held for 48 hours prior to tomography with contrast media. Risk lactic acidosis with potential renal damage. Flashcard 39. The nurse cares for clients in a mental health center. The nurse observes the client, formerly homeless and malnourished, diagnosed with chronic schizophrenia, putting food from lunch into a plastic bag. Which statement by the nurse is most appropriate? 1. We don't allow people to take food from the dining room. 2. What are you going to do with the food? 3. We will be serving snacks and juice at 3 p.m. 4. Let's go watch a movie with the others. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired. Judgmental. Non-therapeutic communication. 2. Assessment. Outcome not desired. Non-therapeutic. Why questions make client defensive. Feel threatened. 3. Correct implementation. Outcome desired. Reality orientation. Talk with client in non-threatening way about her needs. 4. Implementation. Outcome not desired. Misses opportunity to reality test. Distraction used for small children and manic clients. Flashcard 40. The nurse plans care for a client admitted with fever, vomiting, and diarrhea. Which laboratory value demonstrates an improvement in the client's condition? 1. Specific gravity of urine 1.2 and hematocrit 42%. 2. Specific gravity of urine 1.039 and hematocrit 50%. 3. Specific gravity of urine 1.1 and hematocrit 52%. 4. Specific gravity of urine 1.3 and hematocrit 35%. Think of the answer before the reveal. The answer is 1. Correct assessment. Outcome expected. Normal specific gravity of urine. Normal hematocrit. Specific gravity and hematocrit increase with dehydration. 2. Assessment. Outcome not expected. Increased specific gravity of urine. Increased hematocrit. suggests ongoing fluid volume deficit 3 assessment. Outcome not expected. Decreased specific gravity of urine, increased hematocrit. Does not indicate improvement 4 assessment. Outcome not expected. Increased specific gravity of urine, decreased hematocrit. Does not indicate improvement. Flashcard 41. The nurse cares for a client who is to receive thrombolytic therapy with tissue plasminogen activator (RTPA). The nurse is most concerned if the client makes which of the following statements? 1. I take a multivitamin tablet daily for cold and flu prevention. 2. I had major abdominal surgery a year ago. 3. I get some stomach pain when I eat spicy foods. 4. I hit my head and lost consciousness during a car accident 2 months ago. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not a problem. No interaction to implementation. Outcome not a problem. Surgery within 3 weeks is potential contraindication 3. Implementation. Outcome not a problem. Active peptic ulcer disease is potential contraindication. Needs further investigation for correct implementation. Outcome a problem. Significant traumatic head injury within 3 months is an absolute contraindication for thrombolytic therapy. Flashcard 42. A 60-year-old client comes to the Outclient clinic to receive the influenza vaccine. Which of the following questions, if asked by the nurse, is best? 1. Have you had the flu in the past month? 2. Do you have any food allergies? 3. Has anyone in your family been sick? 4. Are you allergic to any medication? Think of the answer before the reveal. The answer is 1. Assessment. Outcome not priority. Immunization deferred in presence of acute respiratory disease or other acute infection to correct assessment. Outcome priority. Allergy to eggs is a contraindication to receiving flu vaccine 3. Assessment. Outcome not priority. Immunization deferred only if client has active infection 4. Assessment. Outcome not priority. Medication allergy not pertinent. Flashcard 43. The home care nurse is visiting an alert, oriented woman living with her daughter. The client is malnourished and has multiple bruises on her body, and the situation is reported to the appropriate authority. After counseling the client and daughter, the nurse notes the situation has not improved. The client decides to remain with her daughter. Which action, if taken by the nurse, is most appropriate? 1. Respect the client's decision to stay in her daughter's home. 2. Insist the client move in with her other child. 3. Begin guardianship procedures. 4. Place live-in help in the home. Think of the answer before the reveal. The answer is 1. Correct implementation. Outcome desired. Intervention not possible without consent of the senior if person is legally competent. Further assessment needed to determine cause of bruises 2. Implementation. Outcome not desired. Legally competent senior can choose where to live and with whom 3. Implementation. Outcome not desired. Appropriate if senior is legally incompetent and in immediate danger 4. Implementation. Outcome not desired. Must have consent of client. Flashcard 44. A news reporter and camera person arrive on the nursing unit to videotape an interview of a client. When the nurse refuses their request, the reporter references his First Amendment rights. Which statement, if made by the nurse, is most appropriate? 1. Why do you want to talk with the client? 2. I'll ask the client if he is ready to speak with you. 3. I will need to call the nurse manager about your request. 4. Does the client know that you are coming? Think of the answer before the reveal. The answer is 1. Assessment. Outcome not priority. Don't ask why questions on the NCLEX RN registered. Why questions are considered to be confrontational to implementation. Outcome not desired. Confirms client presence. Breaches confidentiality. Report to nursing supervisor. 3. Correct follows the chain of command within the facility. 4. Verified the client's admission. Violates client's confidentiality. Flashcard 45. The nurse teaches a client who had an above-knee amputation ACA 2 days ago about how to care for the residual limb. Which statement, if made by the client, indicates to the nurse that the teaching is effective? 1. I shall apply cream to the residual limb to soften the skin. 2. I should rewrap my residual limb with elastic bandages 3 times a day. 3. I will not be able to sleep on my stomach from now on. 4. I will no longer be able to sit in straight back chairs at home. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired. Skin needs to be toughened if prosthesis is going to be used. No lotions, creams, or powders should be used unless prescribed to correct implementation. Outcome desired. Bandages may be loose. Exposed to air 20 min/day. Inspect residual limb for redness, irritation. 3. Implementation. Outcome not desired. The prone position will decrease the risk of flexion contractures. 4. Implementation. Outcome not desired. Client can sit in straight back chair. Time should be restricted to 1 hour or less. Flashcard 46. The school nurse teaches accident prevention to the parents of school-aged children. Which statement, if made by a parent to the nurse, indicates teaching is effective? 1. I'm going to make sure my child wears a helmet, shin guards, and gloves when he rides his bike. 2. I keep my guns and ammunition in a locked cabinet in the basement. 3. The next time we go to the park, I'm going to teach my child the correct way to climb on the monkey bars. 4. I'm going to make sure my wife and I observe our child when he plays outside with friends. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired. Only bicycle helmet is recommended. Additional protective gear with skateboarding or rollerblading. 2. Implementation. Outcome not desired. Guns and ammunition should be kept in separate locked areas. 3. Correct implementation. Outcome desired. Injury prevention facilitated by age-appropriate safety education. 4. Implementation. Outcome not desired. School-aged children are developmentally ready for less supervision. Parents should encourage interaction with peers. Flashcard 47. The nurse cares for a client who had a Roux-en-Y gastric bypass procedure 4 hours ago. The client's vital signs are blood pressure 92/68, apical heart rate 112 per minute, and respiratory rate 22 per minute. Which order should the nurse question? 1. 0.9% sodium chloride water infusion at 150 ml/hour. 2. Epinephrine adrenaline 1 mg bolus intravenously. 3. Monitor urinary output hourly for 24 hours. 4. 50 ml 25% albumin human 50 ml intravenously. Think of the answer before the reveal. The answer is 1 implementation, outcome desired, is isotonic, will replace lost blood volume. 2 correct implementation, outcome not desired, effect is vasoconstriction with further decrease of blood flow to vital organs, used to treat anaphylactic shock. 3 implementation, outcome desired, measuring urinary output more as renal perfusion, appropriate activity. 4 implementation, outcome desired, is a crystalloid, will expand plasma volume rapidly, must carefully monitor response. Flashcard 48. A nurse from the surgical floor is reassigned to the pediatric unit. Which of the following client assignment is most appropriate for this nurse? 1. A 5-month-old infant after a cast application on the left extremity due to club foot. 2. A 4-year-old boy with right abdominal swelling and a decreased appetite. 3. A 6-year-old boy admitted with cystic fibrosis and a temperature of 101.5 F 38.68 C. 4. A 10-year-old girl with newly diagnosed type 1 diabetes. Think of the answer before the reveal. The answer is 1 correct implementation, outcome desired, stable client with predictable outcome, serial casting used to correct congenital clubfoot. 2 implementation, outcome, unstable client, needs assessment and evaluation, possible teaching interventions needed. 3 implementation, outcome not desired, unstable client, require frequent assessment and evaluation. 4 implementation, outcome not desired, unstable client, required assessment, evaluation, teaching, and judgment. Flashcard 49. The home care nurse observes an elderly woman on a low-sodium diet eating a dill pickle that her son gave her with lunch. Which response by the nurse is most appropriate? 1. Giving your mother salty food will only make her condition worse. 2. Didn't your mother tell you she's on a low-sodium diet? 3. Tell me what you know about your mother's diet. 4. Let's make an appointment for you to meet with a dietitian. Think of the answer before the reveal. The answer is 1 implementation, outcome desired but not priority, non-therapeutic, closed statement. 2 assessment, outcome not desired, yes/no question, non-therapeutic. 3 correct assessment, outcome desired, teaching opportunity, includes family and teaching. 4 implementation, outcome not desired, passing the buck. Flashcard 50. The client is admitted to the hospital with chest pain when taking deep breaths and peripheral edema. The healthcare provider's order for the client reads, Digoxin 0.25 mg orally now. Repeat Digoxin 0.25 mg orally in 12 hours. Which action, if taken by the nurse, is most appropriate? 1. Do not administer the second dose of Digoxin. 2. Call the healthcare provider to clarify the order. 3. Administer half the prescribed second dose of Digoxin. 4. Administer the first and second dose of Digoxin as ordered. Think of the answer before the reveal. The answer is 1 implementation, outcome not desired, medication should be given. If nurse questions the order, the healthcare provider should be contacted. 2 implementation, outcome not desired, unnecessary. 1 milligram of Digoxin is a digitalizing dose. Digitalizing dose is necessary to reach therapeutic blood levels. 3 implementation, outcome not desired, nurse can never change prescribed dose. 4 correct implementation, outcome desired, loading dose to achieve therapeutic blood levels. If loading dose not given, therapeutic levels are not reached for 6 days. Flashcard 51. The nurse observes a student nurse examine a client's chest. Which action requires an intervention by the nurse? 1. The student nurse auscultates heart sounds and then palpates for tactile fremitus. 2. The student nurse uses the diaphragm of the stethoscope to listen to heart sounds. 3. The student nurse places the stethoscope firmly against the skin surface. 4. The student nurse inspects the chest before performing palpation. Think of the answer before the reveal. The answer is 1. Correct assessment. Outcome desired. Order for physical assessment is inspection, palpation, percussion, and auscultation. Tactile fremitus is vibration produced when client says 99 to assessment. Outcome desired. Used to listen for high-pitched sounds such as vesicular breath sounds. 3. Assessment. Outcome desired. A tight seal increases accuracy for assessment. Outcome desired. The order for physical assessment is inspection, palpation, percussion, and auscultation. Flashcard 52. The nurse cares for clients on an acute care surgical area. Which client should the nurse see first? 1. The LPN/LVN reports that a client who had a thoracotomy 2 days ago has clots in the chest drainage system. 2. The nursing assistive personnel reports that a client who had a thyroidectomy 24 hours ago refuses to ambulate 30 minutes after receiving hydrocodone Vicodin. 3. The family of a client who had a small bowel resection 48 hours ago reports the client is more confused than yesterday. 4. A client who had an ileostomy 3 days ago complains of aching legs. Think of the answer before the reveal. The answer is 1. Not priority. Further assessment required. See second to not priority. May be safety issue. Further assessment needed. See last 3. Correct priority. May have decreased cerebral blood flow or oxygenation. See first 4. Not priority. Client is at risk for thrombophlebitis. Further assessment and evaluation needed. See third. Flashcard 53. The nurse makes a follow-up phone call to the family of an infant receiving treatment for watery diarrhea after 7 days of amoxicillin-amyxyl therapy. The nurse knows teaching is successful if the family makes which statement? 1. We wear a fresh pair of clean gloves with each diaper change. 2. We are not allowing our other children to be in the same room with the baby. 3. The grandmother wears a mask when changing the baby's diaper. 4. The mother wears an apron when changing the baby's diaper. Think of the answer before the reveal. The answer is 1. Correct implementation. Outcome desired. Contact precautions. Clostridium difficile infection may develop after antibiotic treatment. 2. Implementation. Outcome not desired. Unnecessary. Should use dual and enteric precautions. 3. Implementation. Outcome not desired. Mask unnecessary. Used for airborne infection. 4. Implementation. Outcome not desired. Need to use contact precautions. Gown only if soiling likely. Flashcard 54. A 25-year-old woman is admitted to the labor unit for delivery of her first child. Her husband is coaching her during labor. During the transitional phase of labor, the client begins to scream and grab the side rails with each contraction. Which action, if taken by the nurse, is most effective? 1. Offer the client pain medication before her next contraction. 2. Assist the client to a side-lying position with her knees flexed and a pillow between her legs. 3. Establish eye contact with the client and breathe with her. 4. Suggest to the client that she watch television between contractions. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired, not used during transition, not effective and may interfere with mother's cooperation, may cause respiratory depression in infant. 2. Implementation. Outcome desired, but not priority. Priority action is to assist client to get control. 3. Correct implementation. Outcome desired and priority. Slow breathing. Reorient. Model appropriate behaviors. This will assist client to get control and reduce muscle tension. 4. Implementation. Outcome desired but not priority. Meet physical needs first. Flashcard 55. The client with a 5-year history of alcohol abuse is treated in the emergency room for acute alcohol intoxication. The client is agitated and verbally abusive. Admission orders include chloridase bauxite, Librium 15 mg INM or PO every 4-6 hours for agitation. Which action by the nurse is most appropriate? 1. Place the client in chest restraints. 2. Assist the client to the bathroom every 2 hours. 3. Assign a licensed practical nurse to stay with the client. 4. Administer disulfiram antabuse 500 mg every 12 hours. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired. Last resort, unless safety is an issue. 2. Implementation. Outcome desired, but not priority. Safety is a priority. 3. Correct implementation. Outcome desired. Nurse should delegate and give specific instructions to LPN/LVN. 4. Implementation. Outcome not desired. Administered to assist the client to refrain from drinking. First dose administered at least 12 hours after the last alcohol consumed. Flashcard 56. The nurse reviews health assessments completed by student nurses. Which assessment warrants further investigation? 1. An 11-year-old female who states that she has had 3 periods in the past 6 months. 2. A 13-year-old male with intermittent voice changes. 3. A 14-year-old male with bilateral breast enlargement. 4. A 15-year-old female with bilateral breast buds. Think of the answer before the reveal. The answer is 1. Assessment. Outcome expected. Irregular menstrual periods common during the first year or 2 after menarche. 2. Assessment. Outcome expected. Age appropriate and common. 3. Assessment. Outcome expected. Temporary. Age appropriate phenomenon. 4. Correct assessment. Outcome not expected. One of the earliest changes of puberty occurs from age 9-13. Flashcard 57. An elderly woman is being seen by the home care nurse following a partial gastrectomy for cancer. Which statement, if made by the client, requires further teaching? 1. The healthcare provider told me to come in once a month for vitamin B12 injections. 2. I eat frequently throughout the day. 3. I do not eat concentrated sweets. 4. I drink several glasses of iced tea with my meals. Think of the answer before the reveal. The answer is 1. Implementation. Outcome desired. required monthly to prevent pernicious anemia. 2. Implementation. Outcome desired. Small, frequent feeding prevents dumping syndrome. 3. Implementation. Outcome desired. Prevents dumping syndrome. 4. Correct implementation. Outcome not desired. Drinking fluids with meals causes stomach content to empty too rapidly into the jejunum. Flashcard 58. A client had a right kidney transplant 1 week ago. Which symptom, if experienced by the client, indicates to the nurse that the client is experiencing rejection? 1. The client complains of generalized muscle weakness. 2. The client complains of diffuse pain over the right abdomen. 3. The client gets up twice each night to void. 4. The client has lost 3 pounds. Think of the answer before the reveal. The answer is 1. Assessment. Outcome not priority. Seen with electrolyte imbalance, not rejection. 2. Correct assessment. Outcome priority and expected with kidney rejection. Tenderness over kidney is sign of rejection. 3. Assessment. Outcome not expected. Oliguria is seen with rejection due to failing kidney. 4. Assessment. Outcome not expected. Edema and weight gain are seen with rejection. Flashcard 59. A client is brought to the clinic by the spouse. The client's lab results are not plus 106 m/L, Cl 100 m/L, K plus 4.0 m/L, Bun 86 mg/dl, glucose 100 mg/dl. Which is the most appropriate action for the nurse to take? 1. Assess for muscle weakness and dysrhythmias. 2. Assess for confusion and tachycardia. 3. Check for peripheral edema and lung crackles. 4. Determine if muscular twitching and muscle weakness are present. Think of the answer before the reveal. The answer is 1. Assessment. Outcome not priority. Symptoms of hypokalemia. 2. Correct assessment. Outcome priority. Elevated Na plus and elevated BUN. Other values are normal. Elevated Na plus and BUN seen with dehydration. 3. Assessment. Outcome not priority. Symptoms of fluid volume overload. 4. Assessment. Outcome not priority. Symptoms of hyponatremia. Hypernatremia seen with dehydration. Flashcard 60. A client is prescribed prednisone and asks about possible adverse effects. The nurse teaches the client about which common adverse effects of prednisone. Select all that apply. 1. Osteoporosis. 2. Decreased white count. 3. Low blood sugar. 4. Low serum potassium. 5. Retinal detachment. 6. Fluid retention. Think of the answer before the reveal. The answer is 1. Correct glucocorticoids decrease bone density. Calcium and vitamin D supplements or bisphosphonates will decrease risk. 2. Glucocorticoids depress the immune response, but not the white cell count. 3. Glucocorticoids cause hyperglycemia and glycosuria. 4. Correct glucocorticoids cause hypokalemia and hypernatremia. 5. Glucocorticoids increase the risk of cataracts and glaucoma. 6. Correct glucocorticoids cause sodium and water retention. Flashcard 61. A woman with a diagnosis of Alzheimer's disease is admitted to the hospital for treatment of an upper respiratory tract infection. On admission, she is incontinent of urine. When assigning the client to a room on the nursing unit, which location would be best? 1. A semi-private room near the nurse's station. 2. A private room near the nurse's station. 3. A private room away from the nurse's station. 4. A semi-private room away from the nurse's station. Think of the answer before the reveal. The answer is 1. Correct implementation, outcome desired, and priority. Stimulation helps with orientation, allows for frequent assessment. 2. Implementation, outcome not desired, meets safety needs, but lacks environmental stimulation. 3. Implementation, outcome not desired, client should be frequently assessed and needs stimulation. 4. Implementation, outcome not desired, does provide environmental stimulation, but client should be frequently assessed. Flashcard 62. A 25-year-old multigravida client, 22 weeks gestation, calls to inform the clinic nurse that she was exposed to rubella 2 days ago. Which statement, if made by the nurse, is most appropriate? 1. You need to see the health care provider today, but come in after hours. 2. Come in this afternoon for your regularly scheduled appointment. 3. You will receive the rubella vaccine during your regularly scheduled appointment. 4. Please cancel today's appointment and reschedule for next month. Think of the answer before the reveal. The answer is 1. Implementation, outcome not desired. Incubation period is 14-21 days, not communicable at this time. If woman develops rubella infection during the first trimester, abortion may be considered. 2. Correct implementation, outcome desired. Communicability is approximately 7 days before to 5 days following onset of rash. Client needs to be evaluated. 3. Implementation, outcome not desired. Vaccination contraindicated for pregnant women. Increased risk of fetal complications. 4. Implementation, outcome not desired, needs to be seen by the healthcare provider. Flashcard 63. A 7-year-old boy is brought to the emergency room by his mother following a fall from his bicycle. X-ray reveals healed fractures of the ribs. The child's mother states, "My son is such a careless child. He's always having accidents or fights with his brother." Which response by the nurse would be most appropriate? 1. When I document information about these injuries, it will be on your son's hospital record forever. 2. How would you describe your son's relationship with his brothers and sisters? 3. What I see suggests that someone has been abusing your son. 4. I will need to talk to the nurse manager about this situation before you leave. Think of the answer before the reveal. The answer is 1. Implementation, outcome not desired and not priority. Documentation of suspected abuse should contain facts and be non-judgmental to assessment. Outcome not priority. Priority action is to report potential abuse to nurse manager. 3. Implementation, outcome not desired. Close-ended statement, confrontational. 4. Correct implementation, outcome desired. Follows chain of command, potential abuse situation. Flashcard 64. The parents of a newborn boy ask the nurse whether they should have their son circumcised. Which response by the nurse is most appropriate? 1. The benefits of the procedure usually outweigh the risks of bleeding and infection. 2. You should ask your obstetrician or pediatrician to advise you. 3. It is not mandatory that your son have a circumcision. What are your concerns? 4. Some parents worry about the pain associated with circumcision, but there is actually very little discomfort. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired. Program of good hygiene provides advantages without risks of circumcision. 2. Implementation. Outcome not desired. Passing the buck. 3. Correct assessment. Outcome priority. Open communication. Initial assessment. Acknowledges parents' feelings. 4. Implementation. Outcome not desired. Closed communication. Nurse assumes that pain is the issue. Flashcard 65. The home health nurse is planning client visits for the day. Which of the following clients should the nurse see first? 1. A 70-year-old diabetic with fasting blood glucose readings of 240-260 mg/dl for 1 week. 2. A 65-year-old discharged from the hospital 2 days ago following coronary artery bypass graft surgery CABG. 3. A 55-year-old with congestive heart failure who gained 3 pounds in the last 24 hours. 4. A 40-year-old with metastatic breast cancer complaining of pain unrelieved by pain medication. Think of the answer before the reveal. The answer is 1. Follow-up required, but not priority. See second 2 will require assessment and teaching, but no immediate care indicated. See third 3 correct rapid weight gain indicates fluid retention, which could exacerbate CHF. See first 4 stable client. Pain control will be addressed but not first. See last. Flashcard 66. The home care nurse instructs the daughter of a client diagnosed with congestive heart failure. The daughter states her father is taking digoxin Lanaxin 0.25 mg, and the healthcare provider just prescribed furosemide Lasix 40 mg. Which statement, if made by the daughter to the nurse, indicates teaching is successful? 1. I'm glad that Dad doesn't have to change his diet. 2. Dad is going to have to eat more cottage cheese and add some more salt to his diet. 3. Dad must increase his intake of cheese and yogurt. 4. I should encourage Dad to eat more fresh fruits and vegetables. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired. Lasix is a potassium-wasting diuretic. Hypokalemia may precipitate digitalis toxicity. 2. Implementation. Outcome not desired. High in sodium. Would increase fluid retention. 3. Implementation. Outcome not desired. High in calcium. No indication to increase calcium in the diet. Dairy products are high in sodium. 4. Correct implementation. Outcome desired. Good source of potassium. Decreased potassium can predispose to digitalis toxicity. Flashcard 67. Heparin 5,000 units subcutaneously is ordered every 12 hours for a client. The result of the client's most recent PTT is 55 seconds. Which action by the nurse is most appropriate? 1. Document the result and administer the heparin. 2. Withhold the heparin. 3. Notify the healthcare provider. 4. Have the test repeated. Think of the answer before the reveal. The answer is 1. Correct implementation. Outcome desired. PTT lower limit of normal 20-25 seconds, upper limit of normal 32 to 39 seconds, therapeutic range 1.5 to 2 times normal. 5 seconds is within therapeutic range. 2. Implementation. Outcome medication should be given. PTT is in therapeutic range 3 implementation. Outcome not desired, unnecessary 4 implementation. Outcome not desired, unnecessary. Flashcard 68. The nurse cares for a client diagnosed with a complete spinal cord injury 12 weeks ago due to compression fractures of the 5th and 6th cervical vertebrae. The client reports a sudden onset of sweating and has a flushed face and chest. Which action should the nurse take first? 1. Perform a digital rectal examination. 2. Check the color and temperature of the extremities. 3. Place the client in high Fowler's position. 4. Administer hydralazine apreoline 20 mg intravenously. Think of the answer before the reveal. The answer is 1. Assessment. Outcome not priority. Immediate action to decrease blood pressure is priority. Rectal stimulation may increase autonomic dysreflexia to assessment. Outcome not priority. Immediate need is to reduce blood pressure and prevent hemorrhage. 3. Correct implementation. Outcome desired. Immediate effect. Decrease venous return to heart, decrease stroke volume, and decrease in blood pressure. 4. Implementation. Outcome not desired as initial action causes vasodilation. More immediate effect with position change. If cause of autonomic dysreflexia removed, sudden drop in blood pressure could occur. Flashcard 69. A man is returned to his room in stable condition after a transurethroprostatectomy TURP. He has continuous bladder irrigation through a 3-way urinary drainage catheter with a 30 ml balloon tip. Tension has been applied to the catheter. The client reports that he feels pressure in his bladder and rectum and feels as though he has to urinate. Which action should the nurse take first? 1. Check the patency of the catheter. 2. Assess residual urine volume using bladder ultrasonography. 3. Assess the amount of drainage in the urinary drainage bag. 4. Decrease the tension on the catheter. Think of the answer before the reveal. The answer is 1. Correct assessment. Outcome priority. Catheter may be blocked or client may be having bladder spasms. 2. Assessment. Outcome not priority. Need to check patency of tubing first. 3. Assessment. Outcome not priority. More important to look for obstruction in tubing. 4. Implementation. Outcome not desired. Decrease in traction against bladder neck could cause bleeding. Is a healthcare provider order and should not be changed. Flashcard 70. A client with suspected active tuberculosis is scheduled for a chest X-ray. Which action, if taken by the nurse, is most appropriate? 1. Instruct the staff transporting the client to wear a gown and mask. 2. Place a face mask on the client. 3. Request that the X-ray be postponed. 4. Give the client an emesis basin and tissues. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired. Mask is placed on client to prevent transmission of airborne pathogen. 2. Correct implementation. Outcome desired and priority. Client must wear a standard isolation mask if out of room. 3. Implementation. Outcome not desired. No reason to postpone. Place mask on client. 4. Implementation. Outcome desired, but not priority. Mask worn to prevent transmission of airborne pathogen. Flashcard 71. The nurse cares for an 80-year-old client taking medication for the treatment of hypertension and heart failure. Which action is most important for the nurse to take? 1. Check the client's blood pressure and heart rate immediately after ambulation. 2. Instruct the client to use a walker at all times during ambulation. 3. Encourage the client to walk with the feet as close together as possible. 4. Instruct the client to sit on the edge of the bed for 3 to 5 minutes before arising. Think of the answer before the reveal. The answer is 1. Assessment, outcome not desired. Blood pressure and heart rate should be assessed prior to ambulation. More important to assess for shortness of breath and activity tolerance to implementation. Outcome not desired. Avoid soft-soled shoes. Remove barriers. Orthostatic precautions are priority. No indication in the question that a walker is needed. 3. Implementation. Outcome not desired. Should have wide-based gait to distribute center of gravity. May be unsafe. Ambulation. 4. Correct implementation. Outcome desired and priority. Elderly have decreased cerebral perfusion. Antihypertensives and medications used to treat heart failure cause vasodilation. Flashcard 72. Haloperidol Haldol 5 mg IM every 4 hours PRN is prescribed for a client. Which observation requires an immediate intervention by the nurse? 1. Patient reports dizziness, heart rate 58 beats per minute. 2. Patient has tongue protrusion and muscle rigidity. 3. Patient has a facial rash and periorbital edema. 4. Patient reports sensitivity to light and blurred vision. Think of the answer before the reveal. The answer is 1. Assessment, outcome a concern, but not priority, can cause tachycardia. 2. Correct assessment, outcome not expected and priority. Extrapyramidal reactions usually dose-related, controlled by dose reduction or antiparkinsonian medications. Benztropine. 3. Assessment, outcome a concern, but not priority. Possible maculopapular rash. 4. Assessment, outcome a concern, but not priority. Intolerance to light not seen. Blurred vision not commonly seen. Flashcard 73. The nurse teaches the client how to perform a colostomy irrigation. During the teaching, the client states, "I can't do this." Which response, if made by the nurse, is best? 1. Sure, you can do this. You just need to have more practice. 2. I'll do it for you this time, but you must perform the irrigation the next time. 3. You seem to be frustrated. What are your specific concerns? 4. Most of the other clients learn this without any difficulty. Let's try it again. Think of the answer before the reveal. The answer is 1. Implementation, outcome not desired, false reassurance, need to assess first. 2. Implementation, outcome not desired, fosters dependence. 3. Correct implementation, outcome not desired, reflects feelings, allows nurse to assess. 4. Implementation, outcome not desired, implies deficiency in the client. Flashcard 74. A man comes into the out-client rheumatology clinic for follow-up care after an episode of acute gouty arthritis. The nurse would be most concerned if the client made which of the following statements? 1. I don't eat shrimp and scallops anymore. 2. I play softball twice a week without any problem. 3. I don't go to bars on Friday nights anymore. 4. I have been drinking Slim Fast for breakfast and lunch each day. Think of the answer before the reveal. The answer is 1. Implementation, outcome not desired, Foods high in purines cause hyperuricemia. 2. Implementation. Outcome not desired. Activity does not precipitate a gout attack. 3. Implementation. Outcome not desired. Excessive drinking precipitates gout. 4. Correct implementation. Outcome desired. Hyperuricemia may result from prolonged fasting. Increases production of ketones, which inhibit normal excretion of uric acid. Flashcard 75. A nurse is performing triage in the emergency department. Which of the following clients should the nurse see first? 1. A client with an open fracture of the left femur. BP 110/60, P86, R20, T 99.2 degrees F 37.3 degrees C. 2. A client complaining of a crushing headache. BP 160/100, P76, R18, T 98.4 degrees F 36.9 degrees C. 3. A client with burns on the face, chest, and hands. BP 120/80, P100, R24, T 98.8 degrees F 37 degrees C. 4. A client with type 1 diabetes. Blood sugar 480 mg/dl. BP 100/60, P100, R26, T 99.4 degrees F 37.4 degrees C. Think of the answer before the reveal. The answer is 1C last. Most stable client. 2C second. Unstable client. Cardiovascular. Requires further assessment and antihypertensive medication. 3. Correct. C first. Unstable client. Upper airway injury possibly due to inhalation injury. 4. C third. Vital signs consistent with dehydration. Rapid respiration as cusmols and expected. Flashcard 76. The home care nurse makes an initial visit to an 80-year-old client. The client's daughter states that her mother has a history of colon cancer and has been restless and confused for about a week. It is most important for the nurse to obtain an answer to which question? 1. What medication is your mother taking? 2. Is there a family history of diabetes? 3. Describe your mother's usual diet. 4. Does your mother complain of difficulty urinating? Think of the answer before the reveal. The answer is 1. Correct assessment, outcome desired, and priority. Confusion can be caused by drug toxicity and polypharmacy. Decreased renal function may increase risk to assessment. Outcome desired, but not priority. Hypoglycemia may be a factor. 3. Assessment. Outcome desired, but not priority, is a good open-ended question for assessment. Outcome desired, but not priority. Not most important. Urinary tract infections cause acute confusion in elderly. Flashcard 77. The nurse cares for a client in active labor. The client's membranes rupture spontaneously at 6 centimeters of dilation. Which action should the nurse take first? 1. Check the fetal monitor. 2. Place the client on her right side. 3. Auscultate fetal heart rate. 4. Check the client's heart rate and blood pressure. Think of the answer before the reveal. The answer is 1. Assessment, outcome not desired. Check client, not equipment. Fetal monitor may give incorrect information. 2. Implementation, outcome not desired. Position on left side if needed to prevent pressure on vena cava. No information in question indicates fetal hypoxia. 3. Correct assessment, outcome priority. Check for possible prolapsed cord. Recheck in 10 minutes. Fetal assessment is priority during labor. 4 assessment, outcome not priority, provides no information about baby. Flashcard 78. The nurse receives a phone call from the mother of a 10-year-old child taking methylphenidate Ritalin daily. The mother reports the child has lost 2 pounds in the last 2 weeks. Which is the most appropriate response by the nurse? 1. How much does your child exercise on a daily basis? 2. Stop giving the Ritalin for several days to see if the appetite improves. 3. At what time do you give your child the Ritalin medication? 4. What is your child's bedtime and when does he usually awaken? Think of the answer before the reveal. The answer is 1 assessment, outcome desired, but not priority. Methylphenidate has appetite suppressant effects. 2 implementation, outcome not desired. Ritalin should be tapered. 3 correct assessment, outcome desired, and priority. Long-acting Ritalin should be given after breakfast to decrease appetite suppressant effects. 4 assessment, outcome not priority. More important to assess effective medication on appetite. Flashcard 79. The home care nurse visits a client diagnosed with Parkinson's disease. The nurse is most concerned if which of the following is observed? 1. The client has soft, monotonous speech. 2. The client is drooling. 3. The client rolls the left thumb against the fingers. 4. The client ambulates with a stooped posture. Think of the answer before the reveal. The answer is 1 assessment, outcome expected, hypotonia, speech may be hard to understand. 2 correct assessment, outcome not expected, at risk for aspiration due to difficulty swallowing and the accumulation of saliva. 3 assessment, outcome expected, present at rest, may disappear with purposeful movement. 4 assessment, outcome expected, teach postural exercises to minimize this effect. Flashcard 80. The nurse discusses an appropriate diet with a client diagnosed with iron deficiency anemia. Which meal, if selected by the client, indicates to the nurse that teaching is effective? 1. Spaghetti with a sauce of ground beef, cheese, and garlic bread. 2. Baked sausage casserole with rice and sliced tomato. 3. Frankfurter baked beans and chopped cabbage salad. 4. Lamb chop, baked potato, and tossed green salad. Think of the answer before the reveal. The answer is 1 implementation, outcome not desired. Only beef is a good source. 2 implementation, outcome not desired. Only sausage is good source. 3 implementation, outcome not desired. Low in iron. 4 correct implementation, outcome desired. Contains 24-30 mg. Vitamin C from potato and salad enhance iron availability. Flashcard 81. The nurse cares for a client 4 hours after admission to the hospital for treatment of an anterior wall myocardial infarction. The client suddenly reports difficulty breathing and appears very anxious. Which action should the nurse take first? 1. Evaluate the client's cardiac rhythm. 2. Check for cyanosis of the hands and the toes. 3. Auscultate the client's posterior lung fields. 4. Listen to the apical heart rate. Think of the answer before the reveal. The answer is 1 assessment, outcome desired, but not priority. ABCs apply here. 2 assessment, outcome not desired. Peripheral cyanosis is a late sign of hypoxemia. 3. Correct assessment. Outcome priority. Anterior wall MI high risk for heart failure. Assess client first and then equipment for assessment. Outcome desired, but not priority, should be assessed, but ABCs apply here. Flashcard 82. The nurse cares for a client 72 hours after a right below knee amputation. Which is the most important action for the nurse to take? 1. Lay the client prone for 25 minutes every 3-4 hours. 2. Dangle the client's residual limb over the side of the bed. 3. Abduct the client's residual limb by placing pillows between the legs. 4. Elevate the client's residual limb on a pillow. Think of the answer before the reveal. The answer is 1. Correct implementation. Outcome desired. Prevents hip flexion contracture. 2. Implementation. Outcome not desired. Will increase edema. 3. Implementation. Outcome not desired. Legs should be adducted to prevent flexion contractures. 4. Implementation. Outcome not desired. Done for the first 24 hours. Increases venous return. Prevents edema. Promotes comfort. Flashcard 83. The nurse presents a class on herbal medications at a community healthcare seminar. Which statement should be included in the class? Select all that apply. 1. The potency of herbal preparations varies between manufacturers. 2. The FDA tests and regulates herbal preparations. 3. Herbal preparations are classified as dietary supplements. 4. Malwang contains ephedra and can be dangerous for people with high blood pressure. 5. Herbal preparations are used in the treatment of immune system dysfunction. Think of the answer before the reveal. The answer is 1. Correct. Read labels carefully to determine the exact amount of herbs in the preparation. 2. Herbal preparations are classified as dietary supplements. Adverse reactions may be reported after use. 3. Correct. The FDA does not research or regulate herbal preparations because they are classified as dietary supplements. 4. Correct. Read labels carefully to determine what the herbal preparation contains. 5. Label should state that the herbal preparation will decrease inflammation or support the immune system. Label cannot say that the preparation protects against cancer. Flashcard 84. The nurse feeds the client in a chair when the client suddenly begins to choke on food. The client is conscious but unable to speak. Which action is most appropriate for the nurse to take? 1. Encourage the client to cough and breathe deeply. 2. Leave the client in the chair and apply vigorous abdominal or chest thrusts from behind. 3. Return the client to the bed and apply vigorous abdominal or chest thrusts while straddling the client's thighs. 4. Apply several vigorous back blows until the food dislodges. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired. Can't inhale. Can't exert enough pressure to correct implementation. Outcome desired. Abdominal thrust maneuver appropriate when client not moving. 3. Implementation. Outcome not desired. No time to do this. 4. Implementation. Outcome not desired. Could cause increased problems. Food could migrate further into respiratory tract. Flashcard 85. While playing on the floor in the hospital room, a 2-year-old has a tonic-clonic seizure. Which action should the nurse take first? 1. Begin oxygen at 2 liters per minute through a nasal cannula. 2. Place the client in a side-lying position. 3. Administer diazepam diastat 5 mg rectally. 4. Move the client into a supine position. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired. More important to protect from injury during the seizure. No indication oxygen is needed to correct implementation. Outcome desired. Protects client's airway and keeps the client safe from injury. 3. Implementation. Outcome not desired. Rectal diazepam used to treat status epilepticus in children. Not indicated for single seizure. 4. Implementation. Outcome not desired. Placing the client in a supine position increases risk for aspiration. Flashcard 86. The nurse describes to a male client how to collect a clean catch urine for culture and sensitivity. Which explanation, if made by the nurse, is most accurate? 1. The urinary meatus is cleansed with an antiseptic solution, and then a urinary drainage catheter is inserted to obtain urine. 2. You will be asked to empty your bladder 1/2 hour before the test. You will then be asked to void into a container. 3. Before voiding, the urinary meatus is cleansed with an antiseptic solution. Urine is then voided into a sterile container. The container must not touch the penis. 4. You must void a few drops of urine and then stop. Then void the remaining urine into a clean container which should be immediately covered. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired. Unnecessary to use catheter. 2. This is the procedure for a double void specimen and the question is for a clean catch specimen. 3. Correct implementation. Outcome desired. A culture and sensitivity urinalysis is a sterile specimen. 4. Implementation. Outcome not desired. Needs sterile container. Flashcard 87. An LPN/LVN informs the nurse that aspirin 325 mg was given to a client even though 80 mg aspirin had been ordered once daily. The LPN/LVN asks the nurse if it is necessary to complete a medication error form since no harm was done. Which statement, if made by the nurse, is best? 1. What do you mean, no harm was done? 2. A medication error form must be completed whenever the wrong preparation of a medication is given. 3. I will call the healthcare provider and ask what should be done to deal with this error. 4. It is not necessary to complete an incident report with over-the-counter medications. Think of the answer before the reveal. The answer is 1. Assessment. Outcome not priority. Assessment of client must be done by a nurse. Question is not necessary to correct implementation. Outcome desired. Contains full description of situation. Error committed. Condition of client. Remedial steps taken. Medication error form must be completed for all variances. 3. Implementation. Outcome not desired. It is a nursing responsibility. Healthcare providers should be informed. 4. Implementation. Outcome not desired. Always complete form for any medication error. Flashcard 88. The nurse counsels a woman at 36 weeks gestation who has attended childbirth class in preparation for labor and delivery. Which statement by the client requires an intervention by the nurse? 1. I now know when to expect discomfort during labor and delivery and the things I can do to decrease the discomfort. 2. My husband is still concerned that he is not sure what to do during the labor process. 3. Even though I learned pain control techniques, I still may need some pain medication during labor and delivery. 4. The breathing patterns I learned in class will decrease the amount of time I spend in labor. Think of the answer before the reveal. The answer is 1. Implementation. Outcome desired. Purpose of childbirth class is to eliminate fear of the unknown. 2. Implementation. Outcome not desired, but not priority. Focus of class is on fetus and mother. Further assessment needed. 3. Implementation. Outcome desired. Anxiety and pain reduction techniques included in class, but mothers are encouraged to use analgesia if needed for correct implementation. Outcome not desired. Breathing techniques may decrease anxiety and pain, but have no effect on time of labor. Flashcard 89. The nurse cares for a client with suspected subarachnoid hemorrhage who had a bilateral carotid angiogram 2 hours ago. Which finding requires an intervention by the nurse? 1. The client requests a large glass of water. 2. The client lies quietly in bed with a cloth placed over the forehead and eyes. 3. The head of the bed is elevated 30 degrees and the client's legs are bent at the knee. 4. The urine-specific gravity is 1.025. Think of the answer before the reveal. The answer is 1. Implementation. Outcome desired. Client is NPO before the procedure. Risk of dye-induced nausea and vomiting. Encourage fluid to decrease risk of dye-induced nephrotoxicity after the procedure. 2. Implementation. Outcome desired. Photophobia common after subarachnoid hemorrhage. 3. Correct implementation. Outcome not desired and is priority. Leg should be extended and in a neutral position after femoral angiogram. 4. Assessment. Outcome not desired, but not priority. Urine is concentrated. Fluids encouraged to flush dye through kidneys. Flashcard 90. A client calls the healthcare provider's office reporting a rash, intermittent fever, headache, fatigue, muscle pain, and stiff neck. It is most important for the nurse to ask which question? 1. Have you ever felt this way before? 2. Have you noticed any swollen areas on your neck? 3. Have you recently noticed any flea bites? 4. Have you noticed any tick bites recently? Think of the answer before the reveal. The answer is 1. Assessment. Outcome not priority. Question 2. General 2. Assessment. Outcome not priority. Enlarged lymph glands indicate an inflammatory response or a neoplastic disorder. 3. Assessment. Outcome not priority. Causes papular urticaria, not systemic symptoms. 4. Correct assessment. Outcome priority. Symptoms of Lyme disease, causes localized and systemic symptoms. Flashcard 91. The nurse observes a student nurse caring for a client with a tracheostomy and humidified oxygen. Which of the following actions taken by the student nurse requires an intervention by the nurse? 1. The student nurse sets the wall suction to 160 mmHg pressure prior to suctioning. 2. The student nurse increases the oxygen level to 100% prior to suctioning. 3. The student nurse uses a catheter half the size of the tracheostomy opening. 4. The student nurse tells the client to breathe normally as the catheter is inserted. Think of the answer before the reveal. The answer is 1. Correct implementation. Outcome not desired. Will cause trauma to tracheobronchial mucosa. Suction should be set at 80-120 mmHg to implementation. Outcome desired will decrease the risk of tissue hypoxia, is standard of care. Must remember to decrease oxygen level to ordered concentration after suctioning 3 implementation. Outcome desired. A larger catheter will obstruct the lumen and increase the risk of trauma 4 implementation. Outcome desired. Should breathe normally during suctioning. Flashcard 92. A client contaminated with an unidentified hazardous material arrives by ambulance at a local hospital. Which action should the nurse take first? 1. Determine the decontamination that occurred in the field. 2. Reassure the client that he will receive excellent care. 3. Identify the type of hazardous material. 4. Remove all the client's clothing. Think of the answer before the reveal. The answer is 1. Correct assessment. Outcome desired. Nurse needs to determine if the situation is a threat to the caregiver. Important to prevent the spread of contamination. Flushing with water dilutes or reduces the amount of hazardous material to implementation. Not a priority. Attend to the physical needs of client and staff. 3. Assessment. Outcome not desired. Will be done by other health professionals. More important to determine level of decontamination in field. 4. Implementation. Outcome desired, but not a priority. Will reduce 80-90% contamination. More important to determine if decontamination occurred to ensure safety of client and staff. Flashcard 93. The nurse assesses the fetal monitor of a client in labor. Which fetal heart rate pattern requires an intervention by the nurse? 1. A baseline rate of 140-150 between contractions with moderate variability. 2. Consistent heart rate accelerations that coincide with fetal movements. 3. A heart rate that slows following the peak of the contraction and returns to baseline after the contraction ends. 4. Gradual slowing of the heart rate that begins with the onset of the contraction and returns quickly to the baseline. Think of the answer before the reveal. The answer is 1. Assessment. Outcome expected. Normal to assessment. Outcome expected. Reassuring sign of fetal well-being. 3. Correct assessment. Outcome not expected. Late deceleration. Indicates fetal distress and uteroplacental insufficiency. Treatment position on left side. Give O2. Roman 4. Notify healthcare provider for assessment. Outcome expected. Early deceleration. Good fetal outcome. Flashcard 94. A woman is admitted to the hospital with a diagnosis of ovarian cancer. She has been treated with surgery and chemotherapy. The client states that she has no appetite and has lost 10 pounds in the last 4 weeks. Which statement, if made by the nurse, is most important? 1. Have you noticed a decrease in your energy levels lately? 2. Do you notice any swelling of your hands and feet? 3. Describe your normal daily food intake. 4. What are your favorite foods? Think of the answer before the reveal. The answer is 1. Assessment. Outcome desired, but not priority. Energy level decreased with malnutrition. Is also adverse effect of chemotherapy to assessment. Outcome desired, but not priority. Protein deficiency may cause peripheral edema. 3. Assessment. Outcome desired, but not priority. More important to provide nutrition. 4. Correct assessment. Outcome desired and priority. Offer favorite foods to deal with the here and now. Flashcard 95. At 7 a.m., the nurse administers 10 mg glipizide glucotrol XL to a 75-year-old client. At 11 a.m., the nurse notes that the client is drowsy, pale, and has cold, clammy skin. Which is the initial action the nurse will take? 1. Administer 1 mg glucagon subcutaneously. 2. Give the client 1 cup of fruit juice to drink. 3. Determine if the client ate breakfast. 4. Notify the healthcare provider. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired. Glucagon used with severe hypoglycemia or when client cannot take oral fluids to correct implementation. Outcome desired. Symptoms of moderate hypoglycemia. Client can drink juice 3 assessment. Outcome desired, but not priority. More important to increase blood glucose level 4 implementation. Outcome desired, but not priority. Should take action to correct hypoglycemia first. Flashcard 96. The nurse assesses the Roman 4 site before administering vancomycin. The nurse notes that the area around the Roman 4 infusion site is pale and feels cool. Which initial action will the nurse perform? 1. Remove the intravenous catheter and elevate the arm on 1 or 2 pillows. 2. Begin the vancomycin infusion and reassess the infusion site in 15 minutes. 3. Withhold the vancomycin infusion and notify the healthcare provider. 4. Apply warm, moist compresses to the infusion site for 30 minutes and then administer the medication. Think of the answer before the reveal. The answer is 1. Correct implementation. Outcome desired. Possible infiltration. High risk of tissue damage and thrombophlebitis during vancomycin administration. 2. Implementation. Outcome not desired. Priority is to discontinue infusion and prevent harm to client. 3. Implementation. Outcome not desired. Medication should be given. No need to notify healthcare provider. 4. Implementation. Outcome not desired. Warmth indicated for thrombophlebitis, not infiltration. Flashcard 97. The nurse teaches reality orientation to the husband of a woman with Alzheimer's disease and a moderate hearing loss. Which statement, if made by the client's husband, indicates that he understands this technique? 1. I should ask my wife about current events we have discussed. 2. I should reminisce with my wife about past events. 3. I should frequently ask my wife for the date and time. 4. I should place a calendar and clock in an obvious place. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired. Short-term memory affected. Unable to remember. 2. Implementation. Outcome not desired. Will not reorient. 3. Implementation. Outcome not desired. Can cause confusion, anxiety. 4. Correct implementation. Outcome desired and priority. Use of memory aids and cues to help orientation. Give sense of security. Flashcard 98. The nurse observes a man standing with his adult children after the unexpected death of his wife. Which statement by the nurse is most appropriate? 1. I'm sorry about your wife. I'm sure you will miss her. 2. This must be a difficult time for you. I will stay with you. 3. I know you're going to miss your wife. Would you like to talk about some memories you both shared? 4. Is there anything I can get for you? Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired. Should focus on husband, not nursing staff. Assumes husband's feelings. 2. Correct implementation. Outcome desired. Nurse stays with client. Open-ended. Responds to feeling tone. 3. Implementation. Outcome not desired. Should focus on here and now. Assumes husband's feelings. 4. Assessment. Outcome desired, but not priority. Yes/no question. Does not respond to feeling tone. Flashcard 99. The nurse teaches a wellness class to a group of women. The nurse knows that which of the following clients is most at risk for developing cervical cancer? 1. A woman who began menstruating at age 9. 2. A woman who used oral contraceptives for 8 years. 3. A woman diagnosed with endometriosis at age 20. 4. A woman who has had approximately 10 sexual partners. Think of the answer before the reveal. The answer is 1. Assessment. Outcome not priority. Increases risk of breast cancer. 2. Assessment. Outcome not priority. Increases risk of estrogen-dependent cancers. 3. Assessment. Outcome not priority. Not related to cervical cancer. 4. Correct assessment. Outcome priority. Multiple sexual partners increases risk of cervical cancer. Flashcard 100. A 26-year-old woman comes to the emergency room for a possible ruptured ectopic pregnancy. On admission, the client's vital signs are pulse 90, blood pressure 110/70, respirations 20. A half hour later, her vital signs are pulse 120, blood pressure 86/50, respirations 26. Which of the following is the most appropriate initial action for the nurse to take? 1. Administer pain medication. 2. Increase the rate of the Roman 4 fluids. 3. Ask the client to identify where she is. 4. Check the client's white cell count. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired. Address ABCs first. Analgesic medication may cause further decrease in blood pressure. 2. Correct implementation. Outcome desired and priority. Increased pulse. Decreased BP indicates decreased intravascular volume. Symptoms of hypovolemic shock. 3. Assessment. Outcome desired, but not priority. Client in shock. Implementation required. 4. Assessment. Outcome desired, but not priority. Usually won't change unless infection is causing septic shock. Flashcard 101. On the third day after a thyroidectomy, the nurse notes that the client has developed tremors. Which of the following is the most appropriate action for the nurse to take? 1. Check the client's calcium level. 2. Check the client's glucose level. 3. Check the client's potassium level. 4. Check the client's sodium level. Think of the answer before the reveal. The answer is 1. Correct assessment. Outcome priority. Parathyroid gland may be injured, causing hormone levels to decrease, causes decrease in blood calcium. Early signs include tingling of fingers, toes, lips. To assessment. Outcome desired, but not priority. Blood glucose below 50 mg/dl. Symptoms include sweating, trembling, anxiety, hunger, weakness. 3. Assessment. Outcome desired, but not priority. K+ below 3.5 mg/L. Symptoms include fatigue, vomiting, muscle weakness, dysrhythmias. 4. Assessment. Outcome desired, but not priority. if not plus below 135 mx/L. Symptoms include muscle cramps, lethargy, hemiparesis, paralysis of one side of body. Flashcard 102. The nurse cares for a client with Addison's disease who is taking 20 mg hydrocortisone Cortef daily. Which statement by the client requires an intervention by the nurse? 1. I will need to have my blood sugar levels checked while on this medication. 2. I may have episodes of low blood pressure while taking this medication. 3. I need to weigh myself twice a week and keep a record of my weight. 4. I should notify my healthcare provider if I am running a fever. Think of the answer before the reveal. The answer is 1. Assessment. Outcome expected. Glucocorticoids can increase serum glucose levels. 2. Correct assessment. Outcome not expected. Hypertension due to sodium and water retention expected. 3. Assessment. Outcome expected. Weight gain due to sodium and water retention expected. 4. Implementation. Outcome desired. Glucocorticoids have immunosuppressant effect. Client at high risk for infection. Flashcard 103. The nurse cares for a client being maintained on a ventilator. The client suddenly becomes distressed and agitated. Which of the following is the most appropriate action for the nurse to take? 1. Obtain an order for a tranquilizer. 2. Restrain the client. 3. Check the last arterial blood gas result. 4. Assess the client's breathing pattern in relation to the ventilator. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired. Priority is to determine cause of distress. 2. Implementation. Outcome not desired. Physical restraints are a last resort. 3. Incorrect. A current ABG is needed to make any type of decision. 4. Correct assessment. Outcome desired and priority. Is client fighting the ventilator? Symptoms of respiratory distress include restlessness, agitation, apprehension, irritability, pallor, use of accessory muscles, increased pulse, check airway, vital signs, and ABGs. Flashcard 104. The nurse cares for a client with chronic renal failure who has an arteriovenous fistula in the left arm. Which of the following should be included in the care of the client? Select all that apply. 1. Assess and compare blood pressure in both arms. 2. Auscultate for whooshing sound over the fistula. 3. Palpate for warmth and tenderness over the area of the fistula. 4. Instruct the client to avoid getting the left arm wet. 5. Instruct the client to sleep with the left arm in the dependent position. 6. Instruct the client to avoid carrying heavy objects with the left arm. Think of the answer before the reveal. The answer is 1. No constriction of the arm with the fistula may damage fistula. 2. Correct bruit should be heard over the area of the fistula due to increased blood flow. If no bruit heard, notify healthcare provider. 3. Correct increased risk of infection in the fistula area. Possible infection should be reported to healthcare provider. 4. Fistula is internal. No risk of infection from exposure to water. 5. No weight should be placed on the extremity with the fistula. 6. Correct increases the risk of fistula damage. Flashcard 105. The nurse cares for a 24-year-old female client admitted to an in-client treatment unit with a diagnosis of purging type bulimia. It is most important for the nurse to take which action? 1. Encourage the client to verbalize feelings about eating disorders. 2. Sit with the client in silence as she discusses her daily life and eating habits. 3. Ask the family to describe the client's eating habits prior to admission. 4. Ask the client about any emotional distress she may be experiencing. Think of the answer before the reveal. The answer is 1. Implementation. Outcome desired, but not priority. Priority is to establish trust. 2. Correct implementation. Outcome desired. Establishing trust relationship is first priority. 3. Assessment. Outcome not desired. More important to establish trust. 4. Assessment. Outcome desired, but not priority. May be done after trust relationship established. Flashcard 106. A 22-year-old woman at term comes to the hospital in labor. 2 hours after admission, the client remains 4 centimeters dilated, and her contractions are weak. The healthcare provider orders oxytocin pitocin. Which finding would require an intervention by the nurse? 1. Contractions every 2 minutes, lasting 90 seconds. 2. Contractions every 3-4 minutes, lasting 60 seconds. 3. Feel heart rate of 110 beats per minute at the peak of a contraction. 4. Fetal heart rate of 158 BPM at the end of a contraction. Think of the answer before the reveal. The answer is 1. Correct assessment. Outcome priority. Only 30 seconds between contractions. Hypertonic labor pattern results in fetal distress. 2. Assessment. Outcome not priority. Normal frequency and duration. 3. Assessment. Outcome not priority. Reassuring fetal heart tones. 4. Assessment. Outcome not priority. Reassuring fetal heart tone. Flashcard 107. The nurse cares for a client after a lumbar laminectomy. Which action by the nurse is most important? 1. Elevate the head of the bed 30 degrees and then turn the client. 2. Place a pillow between the client's legs and then turn the client. 3. Have the client grasp the side rail on the opposite side of the bed and then assist the client to turn. 4. Instruct the client to bend the knees and then assist the client to turn. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired. Must stay flat to maintain alignment. 2. Correct implementation. Outcome desired. Log roll repositioning maintains proper alignment of spine. 3. Implementation. Outcome not desired. No twisting allowed. 4. Implementation. Outcome not desired. No twisting allowed. Flashcard 108. An adolescent is admitted to the hospital with a diagnosis of bacterial meningitis. Which of the following actions, if observed by the nurse, would require an intervention? 1. The LPN/LVN enters the client's room and leaves the door open. 2. The nursing assistive personnel leaves the client's room with the face mask hanging from the neck. 3. The student nurse washes hands and puts on gloves. 4. The client's mother stands away from the client while talking to the client. Think of the answer before the reveal. The answer is 1. Implementation. Outcome desired. Droplet precautions necessary. Door may be left open. 2. Correct implementation. Outcome not desired. Used masks should be discarded inside the client's room. 3. Implementation. Outcome desired. Standard precautions used with all clients. 4. Implementation. Outcome desired. Maintain 3-foot separation from infected client. Flashcard 109. A woman is admitted to the hospital complaining of diarrhea and vomiting for 3 days. The blood pressure is 90/60, apical heart rate 96, and respiratory rate 22 with shallow respirations. Laboratory results include Na plus 147 mXL, K plus 5.6 mXL, hematocrit 52%, hemoglobin 14 g/dl. The client is receiving 5% dextrose in 0.45% normal saline with K plus 20 mAc at 125 ml/hr. Prior to calling the healthcare provider, it is most important for the nurse to take which of these actions? 1. Change Roman 4 fluids to 5% dextrose and 0.45% normal saline. 2. Increase Roman 4 flow rate to 150 ml/hour. 3. Check the hourly urine output. 4. Observe the client for muscle weakness. Think of the answer before the reveal. The answer is 1. Correct implementation. Outcome desired. Potassium removed due to hyperkalemia. Hypotonic solution used to correct dehydration. 2. Implementation. Outcome not desired. Will increase serum potassium. 3. Assessment. Outcome not priority. Client is dehydrated. Intervention required. 4. Assessment. Outcome not priority. Lab values indicate hyperkalemia. Flashcard 110. The nurse cares for a client 4 hours after admission to the neuroscience unit due to a closed head injury. Which is the most important action for the nurse to take? 1. Assess pupil shape and reactivity. 2. Take the client's rectal temperature. 3. Assess blood pressure and apical heart rate. 4. Observe the client's oxygen saturation level. Think of the answer before the reveal. The answer is 1. Correct assessment. Outcome desired and priority. Change in pupil size, shape, or reactivity is an early sign of increased intracranial pressure. Report to healthcare provider immediately. To assessment. Outcome not priority. Increased temperature late sign of increased intracranial pressure. Temperature elevation may be due to other injuries. 3. Assessment. Outcome not priority. Changes in vital signs are late sign of increased intracranial pressure. 4. Assessment. Outcome desired, but not priority. Increased carbon dioxide level will increase intracranial pressure. Flashcard 111. The husband of a woman at 39 weeks gestation calls the clinic nurse and states, "My wife's water just broke, and I think she is going to have the baby." Which statement, if made by the nurse, is best? 1. Look at your wife's vaginal area and tell me what you see. 2. Time the contractions for 5 minutes. 3. Tell your wife to pant between contractions. 4. I will instruct you about how to deliver the baby. Think of the answer before the reveal. The answer is 1. Correct assessment. Outcome desired and priority. Determine if presenting part is crowning. 2. Assessment. Outcome desired, but not priority. Need to determine stage of labor first. 3. Implementation. Outcome not desired. Need to determine stage of labor first. 4. Implementation. Outcome not desired. Need to assess first. Flashcard 112. A 60-year-old male client awakens frightened and agitated. He climbs out of bed, removes his indwelling urinary drainage catheter, and runs down the hall screaming. Which of the following is the first action the nurse should take? 1. Notify the healthcare provider. 2. Restrain the client. 3. Replace the urinary catheter. 4. Check for injuries. Think of the answer before the reveal. The answer is 1. Implementation. Outcome desired, but not priority. Assessment needed. 2. Implementation. Outcome not desired. Restraint is last resort. Needs reorientation. 3. Implementation. Outcome desired, but not priority. 4. Correct assessment. Outcome desired and priority. Will guide further assessment and interventions. Will gather needed information to tell healthcare provider. Flashcard 113. The nurse plans care for a 4-year-old girl who has been sexually abused by her grandfather. Play therapy is scheduled as part of the treatment plan. Which statement, if made by the child's parents, indicates understanding of the primary purpose of play therapy? 1. The main goal of play therapy is for a child to deal with any anger that she has. 2. During these play sessions, our child will be encouraged to communicate at her own level. 3. Our child's developmental level will be evaluated by a child development specialist during these sessions. 4. The main purpose of play therapy is to determine exactly what type of abuse occurred. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired. Expression of anger may occur. Main goal is communication. 2. Correct implementation. Outcome desired. Child may not be able to express her perception of the events verbally. Play with dolls will facilitate communication. 3. Implementation. Outcome not desired. Not primary goal of play session. Assessment of developmental level may occur. 4. Implementation. Outcome not desired may occur, but not the primary purpose. Flashcard 114. The nurse cares for a client with suspected Neisseria meningitidis infection. Which action is most important for the nurse to take? 1. Wear a gown when entering the room. 2. Place the client in a negative pressure isolation room. 3. Wear a face mask while assisting the client with activities of daily living. 4. Wash hands with soap and water for 3 to 4 minutes when exiting the room. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired. Gown not required with droplet precautions unless risk contact with body fluids. 2. Implementation. Outcome not desired. Negative pressure isolation room used for airborne precautions. 3. Correct implementation. Outcome desired. Place on droplet precautions because organisms spread by larger droplets. 4. Implementation. Outcome not desired. Length of hand washing does not need to be extended. Flashcard 115. A client is brought to the mental health center reporting severe headaches, insomnia, and poor appetite. Each time a question is asked, the client provides a lengthy, detailed description of events. Which of the following is the most important action for the nurse to take? 1. Remind the client of the time. 2. Tell the client that people are there to take care of her. 3. Sit and listen to the client. 4. Ask the client to be brief. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired. Should allow client the time to express needs. Non-therapeutic response to implementation. Outcome not desired. False reassurance. blocks communication. 3. Correct implementation. Outcome desired. Assess first to meet client needs. Allow client to express needs. 4. Implementation. Outcome not desired. Non-therapeutic. Nurses controlling the interview. Flashcard 116. Based on the nurse's knowledge of the goal of diuretic therapy for a client with heart failure, which assessment best indicates that the client's condition is improving? 1. The client's weight has decreased 2 pounds. 2. The client's systolic blood pressure has decreased. 3. The client has fewer crackles heard during auscultation. 4. The client's urinary output has increased. Think of the answer before the reveal. The answer is 1. Assessment. Outcome expected, but not priority. Could be due to changes in appetite. No time frame given in question to assessment. Outcome expected, but not priority. Could be due to other causes such as change in position. 3. Correct assessment. Outcome priority. Reason for diuretics. Diuretic reduces alveolar edema and pulmonary venous pressure. 4. Assessment. Outcome expected, but not priority. Will increase due to diuretic, but may not change heart failure. Flashcard 117. The home care nurse performs a health screening at the local mall. The nurse knows that which of the following clients is at highest risk for developing a stroke? 1. A 32-year-old Caucasian female who has a history of type 1 diabetes mellitus and has used oral contraceptive for 8 years. 2. A 49-year-old Caucasian male who works as an account executive at an ad agency and has a cholesterol level of 250 mg/dl. 3. A 56-year-old African-American female who consumes 1 to 2 alcoholic beverages weekly and has smoked cigarettes for 30 years. 4. A 69-year-old African-American male who has a history of hypertension and is 30 pounds overweight. Think of the answer before the reveal. The answer is 1. Assessment. Outcome not priority. Risk factors include diabetes and oral contraceptive use to assessment. Outcome not priority. Risk factors include high cholesterol. No demonstrated relationship between occupation and stroke. 3. Assessment not priority. Risk factors include race and smoking. Daily consumption of 2 or more alcoholic beverages a day increases risk of hypertension and stroke. 4. Correct assessment. Priority. Risk factors include age, race, hypertension, and obesity. Flashcard 118. The nurse supervises the distribution of meal trays on a medical unit. Which tray should be given to a client who has requested a kosher diet? 1. Cheeseburger, sliced tomato, French fries, and a milkshake. 2. Pork chops, applesauce, baked potato, and ginger ale. 3. Shrimp salad, sliced avocado, bread, and coffee. 4. Fruit salad, cottage cheese, crackers, and tea. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired. Cannot eat dairy and meat at the same meal. Eat dairy 6 hours after meat meal. 2. Implementation. Outcome not desired. Cannot eat pork products, bacon, ham, animal shortening, gelatin, or foods containing gelatin, for example marshmallows. 3. Implementation. Outcome not desired. Cannot eat shellfish or scavenger fish. Fish must have scales. 4. Correct implementation. Outcome desired. Kosher diet follows Jewish law. No meat or poultry at the same meal as dairy. or using the same utensils, no pork products, no scavenger fish. Flashcard 119. A 56-year-old man is scheduled for an MRI magnetic resonance imaging. His history indicates that he suffered an injury during the Vietnam War. Which question is most important for the nurse to ask the client? 1. Where was your injury? 2. When were you wounded? 3. Did your injury involve shrapnel? 4. Were you exposed to chemical warfare? Think of the answer before the reveal. The answer is 1. Assessment. Outcome not priority. Not significant for MRI. 2. Assessment. Outcome not priority. Not significant for MRI. 3. Correct assessment. Outcome desired and priority. MRI contraindicated with metal prosthesis or implanted metal. 4. Assessment. Outcome not priority. Defoliant used in war. Not significant for MRI. Flashcard 120. The home care nurse is visiting a client terminally ill with pancreatic cancer who wishes to die at home. Which question, if asked by the nurse, is most appropriate? 1. Are you sure you want to die at home? 2. Where will you put the hospital bed? 3. Would you like your minister to visit you? 4. Who will take care of you? Think of the answer before the reveal. The answer is 1. Assessment. Outcome not desired. Psychosocial. Yes/no question. Non-therapeutic. 2. Assessment. Outcome desired, but not priority. Important to obtain the needed equipment, but is very specific. 3. Assessment. Outcome not priority. Passing the buck. Yes/no question. Non-therapeutic. 4. Correct assessment. Outcome desired and priority. Physical need. Meet basic needs first before psychosocial. Flashcard 121. A 52-year-old homeless woman is admitted to the psychiatric unit for treatment of chronic schizophrenia. The nursing assistive personnel reports to the nurse that when attempting to bathe the client became uncooperative and demanded coffee and a snack. Which suggestion will the nurse give to the nursing assistive personnel? 1. Remind the client that too much caffeine is bad for her health. 2. Tell the client that she may have coffee and a snack when her bath is complete. 3. Remove the client from the bath and return her to bed. 4. Get help from other staff members to complete the bath. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired, not effective with this client. 2. Correct implementation. Outcome desired. Would meet client's immediate needs. Is factual answer. 3. Implementation. Outcome not desired. Needs physical needs met. Need to develop trusting relationship. Action may increase distress. 4. Implementation. Outcome not desired. Shouldn't use force. Client should feel environment is safe. Action may increase distress. Flashcard 122. A 39-year-old man is admitted with a diagnosis of acquired immune deficiency syndrome AIDS. His lab results are hemoglobin 9.3 G/DL, hematocrit 25%, platelets 50,000/mm3, white cell count 1,500/mm3. Which order should the nurse implement first? 1. Infuse 2 units of packed red cells. 2. High protein, high carbohydrate diet is tolerated. 3. Administer 2 units platelets. 4. Place the client on neutropenic precautions. Think of the answer before the reveal. The answer is 1. Implementation. Outcome desired, but not priority. Given when hemoglobin is down to 8G/DL2 implementation. Outcome desired, but lower priority. 3. Implementation. Outcome desired, but lower priority. Risk of spontaneous bleeding 1. Platelets 20,000/mm3 or below. 4. Correct implementation. Outcome desired and high priority. At risk for acquiring life-threatening infection due to leukopenia. Flashcard 123. The nurse is caring for an elderly client admitted for type 1 diabetes mellitus. The nurse notes that the client appears to have difficulty understanding what is said. Which of the following actions, if taken by the nurse, is most appropriate? 1. Ask the client if cotton-tipped applicators are used for ear cleaning. 2. Perform the Weber hearing test. 3. Check the client's ear canals for cerumen. 4. Use facial expressions and speak in a high-frequency tone of voice. Think of the answer before the reveal. The answer is 1. Assessment. Outcome not priority. Most common cause is cerumen in elderly. 2. Assessment. Outcome not priority. Cerumen most likely cause. 3. Correct assessment. Outcome priority. Physical. Ear wax becomes drier in elderly. Can block ear canal and cause decreased hearing. 4. Implementation. Outcome not priority. Nonverbal cues useful when speaking to hearing impaired. Need low tones. High-frequency tones are problem for elderly. Flashcard 124. A client with an 8-year history of ulcerative colitis is admitted to the hospital with severe abdominal cramping and diarrhea. The client has experienced 18 to 20 stools a day for the last 4 days. The nurse is most concerned by which finding? 1. The client's diastolic blood pressure decreases 20 mm when the client rises to a standing position. 2. The client's urinary specific gravity is 1.2. 3. The client has lost 3 pounds since her last admission. 4. The client appears pale and thin. Think of the answer before the reveal. The answer is 1. Correct assessment. Outcome priority. Indicates fluid volume deficit. Check blood pressure, supine, sitting, and standing. Other symptoms include concentrated urine and weak, rapid pulse. 2. Assessment. Outcome not priority. Normal 1.010-1.0303. Assessment. Outcome not priority. Don't know when client was last hospitalized for assessment. Outcome not priority. More concerned about fluid volume deficit. Flashcard 125. The nurse cares for a client who returned 4 hours ago after a subtotal thyroidectomy procedure. The nurse notes that the client sounds more hoarse when speaking than he did 1 hour ago. Which of the following is the most appropriate action for the nurse to take? 1. Check the gag and swallow reflex. 2. Instruct the client to chew small amounts of ice chips. 3. Notify the healthcare provider. 4. Instruct the client to cough and breathe deeply every 15 minutes. Think of the answer before the reveal. The answer is 1. Assessment. Outcome desired, but not priority. Not best test for laryngeal damage. 2. Implementation. Outcome not desired. Will not decrease hoarseness. 3. Correct implementation. Outcome priority and desired. Possible laryngeal damage. Further assessment and possible treatment indicated. Do not assume that hoarseness is caused by endotracheal tube 4 implantation. Outcome not desired. May further damage operative site. Flashcard 126. A mother brings her 15-month-old infant to the pediatric clinic for immunizations. The mother tells the nurse that the infant has been diagnosed with cancer and is being treated with chemotherapy. The nurse should question the administration of immunization. 1. Hepatitis B/HB. 2. Measles/mumps/rubella MMR. 3. Inactivated polio IPV. 4. Diphtheria, tetanus toxoid, and cellular pertussis D-P. Think of the answer before the reveal. The answer is 1. Implementation. Outcome desired. No contraindication to correct implementation. Outcome not desired. Live virus not given to immunosuppressed clients. 3. Implementation. Outcome desired. No contraindication for implementation. Outcome desired. Contraindication includes encephalopathy within 7 days. Flashcard 127. The nurse reviews room assignments for 4 clients admitted to the unit. The nurse should question which room assignment. 1. A child with chickenpox placed in a private room at the end of the hall. 2. A child with meningitis placed in a private room across from the nurse's station. 3. A client with cellulitis of the right leg placed in a semi-private room with a client diagnosed with type 1 diabetes. 4. A client with essential hypertension placed in a semi-private room with a client who has pancreatitis. Think of the answer before the reveal. The answer is 1. Implementation. Outcome desired. Communicable disease. Appropriate room placement. 2. Implementation. Outcome desired. Communicable disease. Requires frequent assessment. Client at risk for seizures. 3. Correct implementation. Outcome not desired. Don't put a client with infection cellulitis with a client who is at risk for infection. 4. Implementation. Outcome desired. Appropriate placement. No cross-contamination. Flashcard 128. Levodopa L-Dopa is prescribed for a 61-year-old woman. Which statement, if made by the client to the nurse, would indicate that the client needs further instruction? 1. While I take this medication, I should eat a high-protein diet. 2. I should change positions slowly at first so I don't get dizzy. 3. If I have muscle twitching, I should report it to my healthcare provider. 4. I should check with my healthcare provider before taking any over-the-counter medications. Think of the answer before the reveal. The answer is 1. Correct implementation. Outcome not desired. Take with low-protein diet to decrease GI upset. 2. Implementation. Outcome desired. True. Orthostatic hypotension is common with Parkinson's disease. 3. Implementation. Outcome desired. True. Blepharospasms, twitching eyelid are early signs of overdosage. 4. Implementation. Outcome desired. True. Multivitamins can reverse actions, especially vitamin B6. Flashcard 129. The nursing team consists of 2 RNs, 1 LPN/LVN, and 1 nursing assistive personnel. The nurse should consider the assignment appropriate if the LPN/LVN is required to complete which task? 1. Ambulate a client 8 hours after a thoracotomy. 2. Give an enema to a client prior to a colonoscopy. 3. Complete a bed bath for a client with burns on the arms and legs. 4. Perform a dressing change on a client 3 days after a cholecystectomy. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired. RN needs to frequently assess and evaluate. 2. Implementation. Outcome not desired. Standard. Unchanging procedure assigned to assistive personnel. 3. Implementation. Outcome not desired. High risk of infection and sepsis. RN can do thorough assessment during bath. 4. Correct implementation. Outcome desired. Stable client with an expected outcome. Flashcard 130. The nurse receives a phone call from a mother who is informed that her 10-month-old child was exposed to chickenpox at the day care center. Which statement, if made by the mother, most concerns the nurse? 1. I will give my child Tylenol if a fever develops. 2. I plan to wash the crib sheets often with a mild soap and water. 3. I will keep the baby away from the other children right now. 4. My 85-year-old grandmother is going to help take care of the baby while I am at work. Think of the answer before the reveal. The answer is 1. Implementation. Outcome desired. Increased risk of Ray's syndrome if aspirin is given. 2. Implementation. Outcome desired. No need for stronger additives. May increase skin irritation. 3. Implementation. Outcome desired. Should be isolated until 6 days after appearance of first vesicles. 4. Correct implementation. Outcome not desired. Immune system in elderly depressed. Increased risk of varicella infection. Flashcard 131. The nurse enters a client's room and discovers the client is having difficulty breathing because the tracheostomy tube has become dislodged. Which is the initial action the nurse should take? 1. Perform mouth-to-stoma breathing. 2. Extend the client's neck. 3. Place the client in high Fowler's position. 4. Administer oxygen. Think of the answer before the reveal. The answer is 1. Implementation. Outcome desired, but not priority. Needs airway first. Difficult to ventilate without neck extension. 2. Correct implementation. Outcome desired and priority. Provides patent airway. Call for help. Place supine, then check breath sounds. Use hemostat to open airway. 3. Implementation. Outcome desired, but not priority. Needs airway first. 4. Implementation. Outcome desired, but not priority. Needs airway first. Flashcard 132. The nurse cares for a client in the cardiac care unit who had cardiopulmonary arrest 2 hours ago and was successfully resuscitated by emergency personnel. As the nurse enters the room, the client develops ventricular fibrillation and is unresponsive to loud spoken voice. Which of the following is the initial action the nurse should take? 1. Ventilate the client with a manual resuscitator bag. 2. Defibrillate the client. 3. Administer sodium bicarbonate intravenously. 4. Begin chest compressions. Think of the answer before the reveal. The answer is 1. Implementation. Outcome desired, but not priority. No cardiac output present during ventricular fibrillation. 2. Correct implementation. Outcome desired. Immediate return to normal rhythm needed. Fatal within 5 minutes if not corrected. 3. Implementation. Outcome not desired. Used to correct metabolic acidosis. Priority is to terminate dysrhythmia for implementation. Outcome not desired as initial action. Defibrillation is priority. Flashcard 133. The healthcare provider HCP provider orders hydralazine 25 mg IM on call for a client before surgery. The LPN/LVN administers hydroxyzine 25 mg IM to the client. Which of the following is the most appropriate action for the nurse to take? 1. Document hydralazine 25 mg ordered, hydroxyzine 25 mg given, HCP notified. Blood pressure 130/84, pulse 86, respiration 12. 2. Document hydroxyzine 25 mg given, hydralazine 25 mg ordered, HCP notified. Vital signs stable. 3. Document hydroxyzine 25 mg mistakenly given, hydralazine 25 mg ordered. 4. Document hydroxyzine 25 mg given, incident report completed. Think of the answer before the reveal. The answer is 1. Correct implementation. Outcome desired. Objective. Indicates nurse has monitored client 2 implementation. Outcome not desired, not best. Contains judgment 3 implementation. Outcome not desired, incomplete. Subjective 4 implementation. Outcome not desired. Incident report not part of legal record. Flashcard 134. 2 days after admission to an alcoholic treatment unit, a 40-year-old man brags about his binges and boasts that he has not had a steady job in 3 years. Which activity, if selected by the nurse, would be most appropriate for this client? 1. Ask the client to lead a group discussion on alcoholism. 2. Ask the client to orient a client to the unit. 3. Encourage the client to play table tennis with other clients. 4. Have the client assume responsibility for the cleanliness of the dining. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired, not appropriate at start of treatment. 2. Implementation. Outcome not desired, later phase. Not ready. 3. Implementation. Outcome not desired, not appropriate at this time in treatment. 4. Correct. Have the client assume responsibility for the cleanliness of the dining room. Flashcard 135. The healthcare provider orders furosemide Lasix and spironolactone aldactone. Prior to administering Lasix and aldactone, the nurse determines that the client's potassium level is 3.2 mg/L. Which is the most important action for the nurse to take? 1. Hold the furosemide and spironolactone. 2. Administer only the spironolactone. 3. Administer only the furosemide. 4. Administer the furosemide and spironolactone. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired. Should give aldactone. K+ bearing diuretic. 2. Correct implementation. Outcome desired. K+ bearing diuretic. Should contact healthcare provider about serum potassium. 3. Implementation. Outcome not desired. Will lose more potassium. 4. Implementation. Outcome not desired. Will lose more potassium. Flashcard 136. The nurse is caring for an elderly client receiving total parenteral nutrition TPN due to malnutrition. Which observation, if made by the nurse, indicates that the client is improving? 1. The client gains 8 pounds in 1 week. 2. The client's edema decreases. 3. The client's hemoglobin increases. 4. The client's output is greater than the intake. Think of the answer before the reveal. The answer is 1. Assessment, outcome not expected, indicates fluid retention. 2. Correct assessment, outcome expected, edema is manifestation of malnutrition. Decreased serum protein levels cause fluid to move into interstitial space. 3. Assessment, outcome not expected, hemoglobin may increase with increased iron levels. 4. Assessment, outcome not expected, TPN can cause hyperosmolar diuresis due to hyperglycemia, complication of TPN. Flashcard 137. The nurse teaches elderly residents of an assisted living facility about wellness and health promotion. The nurse is most concerned about which statement by one of the residents? 1. My health care provider tells me I may need the chickenpox vaccine. 2. I get my flu shot every year in November at a local pharmacy. 3. I got a pneumonia vaccine about 10 years ago. 4. The last time I got an injection in my arm, it felt hot and swollen for a day. Think of the answer before the reveal. The answer is 1. Implementation, outcome may be desired, but is not priority. Varicella vaccine recommended for adults who are not immune to varicella or who are immunocompromised. Need further assessment. 2. Implementation, outcome desired, but not priority, should be given earlier in the winter. Yearly influenza vaccine recommended for older adults. 3. Correct implementation, outcome not desired and is problem. Vaccine 6 years ago or more needs to be repeated. Elderly at great risk for streptococcal pneumonia. 4. Implementation, outcome, needs follow-up, but not of most concern. Flashcard 138. The nurse is called to the bathroom of a woman who delivered an 8lb4 male 12 hours ago. The nurse notes that there is blood running down the client's leg. Which statement, if made by the nurse, is best? 1. Leave your perineal pad in the bathroom so I can evaluate the lochia. 2. Why don't you go back to bed so you can rest? 3. Let me help you back to bed so I can check your fundus. 4. Sit in this chair so I can check your blood pressure. Think of the answer before the reveal. The answer is 1. Assessment, outcome desired, but not priority, more important to determine source of bleeding. 2. Implementation, outcome not desired, need to determine source of bleeding, need to assist client. 3. Correct assessment, outcome priority, determine if fundus is firm, bleeding may be caused by pooling of lochia in the vagina. 4. Assessment, outcome desired, but not priority, more important to determine the source of bleeding. Flashcard 139. The nurse supervises care of clients on a postoperative surgical unit. Which of the following requires an immediate intervention by the nurse? 1. The nursing assistive personnel NAP obtains vital signs on a client who had a bowel resection 24 hours ago. 2. The NAP assists a client who had an above-the-knee amputation apply an elastic bandage to the residual limb. 3. The NAP assists a client who had a stroke 3 days ago with feeding. 4. The NAP assists a client who had a laparoscopic cholecystectomy 6 hours ago ambulate. Think of the answer before the reveal. The answer is 1. Assessment, outcome expected, within NAP scope of practice. Principles of delegation should be followed. 2. Implementation, outcome desired, Within NAP scope of practice 3 correct implementation. Outcome not desired. Client requires assessment and evaluation. May have problems with gag and swallow reflex for implementation. Outcome desired. Within NAP scope of practice. Stable client. Principles of delegation should be followed. Flashcard 140. A 50-year-old woman with a history of alcohol abuse is treated in the emergency room for acute alcohol intoxication. It would be most important for the nurse to obtain the answer to which question? 1. When did you have your last drink? 2. How much alcohol have you consumed? 3. Have you ever used drinking in the morning to get rid of a hangover? 4. How many drinks do you need before you feel high? Think of the answer before the reveal. The answer is 1. Correct assessment. Outcome priority. Withdrawal 5-35 hours after last drink. Grand mal seizures 48 hours after. Delirium tremens 72-96 hours after. Client at high risk for seizures to assessment. Outcome not priority. May be included as part of the assessment 3 assessment. Outcome not priority. May be included as part of the assessment 4 assessment. Outcome not the priority. May be included, but timing is more important to anticipate withdrawal. Flashcard 141. The home care nurse visits a client who had a traditional cholecystectomy 10 days ago. The client returned to the healthcare provider to have the T-tube removed 2 days ago. It is most important for the nurse to take which action? 1. Observe the color of the client's urine and stool. 2. Ask the client to describe the quality and quantity of pain she is experiencing. 3. Instruct the client to avoid fatty foods for 6 weeks. 4. Listen to bowel sounds. Think of the answer before the reveal. The answer is 1. Correct assessment. Outcome priority. Clay-colored stools and dark urine indicate that bile is draining into liver to assessment. Outcome not priority. Psychosocial. Not as important as assessing color of urine and stool 3 implementation. Outcome desired, but not priority. Should eat balanced diet and avoid high-fat foods for assessment. Outcome not priority. More important to assess urine and stools. Flashcard 142. A client with a history of gastroesophageal reflux disease reports difficulty sleeping at night. Which of the following is a priority action for the nurse to take? 1. Instruct the client to drink 8 ounces of milk at bedtime. 2. Advise the client to use 2 pillows at night. 3. Instruct the client to limit fat intake during the day. 4. Advise the client to lie down after the evening meal. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired. Increasing stomach volume at bedtime may increase symptoms to correct implementation. Outcome desired. Gravity will prevent reflux of stomach contents into esophagus 3 implementation. Outcome not desired. Caffeine and spicy foods should be limited for implementation. Outcome not desired. Lying down will increase reflux of gastric contents. Flashcard 143. A unit of packed cells is ordered for a client who has an intravenous infusion of dextrose 5% in water in progress. Which of the following is the most important action for the nurse to take? 1. Connect the packed red blood cells to the dextrose infusion. 2. Remove the dextrose infusion and replace it with the packed red cells. 3. Start a separate infusion of normal saline and use a Y connector to infuse the blood. 4. Start an infusion of lactated Ringer's solution and use a Y connector to infuse the blood. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired. Incompatible. Will cause hypertonic hemolysis clumping. 2. Implementation. Outcome not desired. Always start with normal saline 0.9% NaCl. 3. Correct implementation. Outcome desired. Isotonic solution. Y tubing allows for addition of saline to blood cells and provides access for saline flush if transfusion is interrupted. 4. Start an infusion of lactated Ringer's solution and use a Y connector to infuse the blood. Flashcard 144. A 42-year-old woman has a right mastectomy for treatment of breast cancer. The client is returned to her room with a hemovac drain. Which of the following is the most important action for the nurse to take? 1. Open the drain port to provide an air vent. 2. Tape the collection chamber to the client's bed. 3. Compress the evacuator completely after emptying it. 4. Empty the collection chamber every 2 hours. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired. Should be closed except when emptying chamber. 2. Implementation. Outcome not desired. Should be secured to client's dressing or clothing, not to the bed. 3. Correct implementation. Outcome desired. Provides for negative pressure of 45 mmHg for wound suction. 4. Implementation. Outcome not desired. Should not open unit unnecessarily due to chance of contamination. Flashcard 145. A mother brings her 2-month-old infant to the emergency room. The mother states that her daughter has an elevated temperature and hasn't kept anything down since yesterday. Which nursing action is most appropriate? 1. Administer 0.9% NaCl at 30 ml/hour. 2. Inquire if the child was delivered prematurely. 3. Offer the infant 4 Oz of oral rehydration solution ORS. 4. Ask if the child's older siblings have been ill. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired at this time. Offer oral rehydration therapy first. Continue to assess fluid and electrolyte balance. May use if severe dehydration or shock noted. 2. Assessment. Outcome not priority. Need to meet physical needs for fluids to prevent or treat dehydration. 3. Correct implementation. Outcome desired. Offer oral rehydration therapy first with moderate dehydration. 4. Assessment. Outcome not priority. Flashcard 146. The nurse teaches a client with a spinal cord injury how to perform self-catheterization at home. Which statement, if made by the client, indicates that teaching has been successful? 1. I will keep the catheter in a plastic bag. 2. I will catheterize myself every 2 hours. 3. I will wear sterile gloves. 4. I will wash the perineum with alcohol prior to catheterizing myself. Think of the answer before the reveal. The answer is 1. Correct implementation. Outcome desired. After use, catheter is soaked in solution of betadine, bleach, or hydrogen peroxide, then dried and stored in a towel or bag. Clean procedure in the home. To implementation. Outcome not desired. done every 6-8 hours. 3. Implementation. Outcome not desired. Clean procedure in the home. Less risk of contamination. 4. Implementation. Outcome not desired. Wash with soap and water. Flashcard 147. The nurse plans care for a 42-year-old man receiving disulfiram antabuse. Which of the following statements requires an immediate intervention by the nurse? 1. This medication will prevent me from drinking alcohol. 2. I should not take cough syrup preparations while taking antabuse. 3. If I discontinue the antabuse, I should not consume alcohol for 2 weeks. 4. Even small amounts of alcohol may cause nausea, vomiting, and headache. Think of the answer before the reveal. The answer is 1. Correct. Implementation. Outcome not desired. Does not prevent drinking. Unpleasant reaction may decrease frequency of drinking. 2. Implementation. Outcome desired. Must avoid all forms of alcohol, sauces, cough syrups, external, shaving lotions, liniments, back rub preparations. 3. Implementation. Outcome desired. Effects continue for 2 weeks. 4. Implementation. Outcome desired. Amounts as small as 7 ounces can cause reaction. Flashcard 148. A registered nurse from a surgical floor is reassigned to a medical unit. Which of the assignment is most appropriate for this nurse? 1. A client with type 1 diabetes mellitus scheduled for discharge at 2 p.m. 2. A client admitted 4 hours ago with a diagnosis of myocardial infarction. 3. A client with Alzheimer's disease who requires a tube feeding. 4. A client admitted yesterday with a diagnosis of left-sided cerebral vascular accident. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired. Client requires discharge instructions. 2. Implementation. Outcome not desired. Client requires frequent assessment. 3. Correct. Implementation. Outcome desired. Stable client with an expected outcome. 4. Implementation. Outcome not desired. Client requires frequent assessment. Flashcard 149. The nurse instructs a client on 100 mg losartan Kazar and 25 mg hydrochlorothiazide Hyzar 100-25 tablets to be taken once daily. Which statement requires an intervention by the nurse? 1. I will eat more fresh fruits while taking this medication. 2. I should call my health care provider if I develop swelling of my lips. 3. I can take this medication with or without food. 4. I understand that I may develop a dry cough while taking this medication. Think of the answer before the reveal. The answer is 1. Implementation. Outcome desired. Hydrochlorothiazide is potassium wasting diuretic. 2. Implementation. Outcome desired. Angiotensin receptor blockers ARBs may cause angioedema. 3. Implementation. Outcome desired. May be taken with or without food. 4. Correct. Implementation. Outcome not expected. Dry, non-productive cough may occur with angiotensin converting enzyme inhibitors, ACE inhibitors, not ARBs. Flashcard 150. The healthcare provider has ordered a fenestrated tracheostomy tube to be capped. Which is the most important action for the nurse to take before the tracheostomy tube is plugged? 1. Administer 100% oxygen. 2. Deflate the cuff of the tracheostomy tube. 3. Suction the tracheostomy tube. 4. Administer humidified oxygen. Think of the answer before the reveal. The answer is 1. Implementation. Outcome not desired. Unnecessary in this situation. Done before suctioning. 2. Correct implementation. Outcome desired. Allows for an airway. 3. Implementation. Outcome not desired. Perform only as needed for congestion. 4. Implementation. Outcome not desired. When O2 is administered, it should be humidified, though O2 is not required in this situation.